I recited the medical dictionary from memory for 3 hours. This is how my kidneys shut down. A, prefix, meaning not and without. A bands, the dark staining anisotropic cross striations in the myofibrils of muscle fibers, comprising regions of overlapping thick myosin and thin actin filaments. Alpha cells, pertaining to endocrine cells of pancreatic origin contained within the islets, also refers to cells in the anterior lobe of the adeno hypophysis. Alpha chain, the shorter polypeptide component of insulin containing 21 amino acyl residues, beginning with a glycyl residue at the NH2 terminus. Insulin consists of an alpha chain linked to a beta chain by 2 disulfide bonds. The amino acid composition of the alpha chain is a function of the species. Alpha fetoprotein, a protein normally produced between weeks 12 and 15 of gestation, decreasing thereafter, but appearing in the blood in certain tumors such as embryonal carcinomas of the testes, ovaries, and hepatoma, and less often in patients with carcinomas of the pancreas, stomach, colon, or lung. When present, a useful marker in following the course of a tumor. A fibers, myelinated nerve fibers in somatic nerves measuring 1 to 22 micrometers in diameter, conducting nerve impulses at a rate of 6 to 120 meters per second. Alpha granules, large rod-like filamentous granules found in several types of cells, especially platelets, where they are the most numerous type of granule. They contain secretory proteins including fibrinogen, fibronectin, fibrospondin, von Willebrand factor, collectively known as adhesive proteins, and other proteins, most notably platelet factor 4, platelet-derived growth factor, coagulation factor 5. Alpha helix, the helical form, commonly right-handed, present in many proteins deduced from X-ray diffraction studies of proteins such as alpha-keratin. The helix is stabilized by hydrogen bonds between different U-peptide bonds. Alpha thalassemia, an anemia due to one of 2 or more genes that depress the synthesis of alpha globin chains by the chromosome within the abnormal gene. A-wave, the initial negative deflection in the electroretinogram, presumably reflecting retinal photoreceptor activity. It's also defined as an atrial deflection in an electrogram recorded from within the atrium of the heart. It's also defined as the first positive deflection of the atrial and venous pulses due to atrial systole. Alpha hemolysis, a hemolysis observed in blood agar cultures of occasional strains of pneumococci and streptococci. The zone of hemolysis about the colony is greenish, caused by a partial decomposition of hemoglobin. Alpha adrenergic receptors, receptors that respond to epinephrine and norepinephrine in effector tissues capable of selective activation and blockade by drugs. Conceptually derived from the ability of certain agents, such as phenoxybenzamine, to block only some adrenergic receptors, and of other agents, such as methoxamine, to activate only the alpha subtype of the receptors. Their activation results in physiologic responses such as increased peripheral vascular resistance, mydriasis, and the contraction of pilomotor muscles. AC interval, the interval between the onset of the wave and that of the C wave of the jugular pulse. Alpha chain disease, a vague or indefinite term, could be used for alpha heavy chain disease, a lymphoplasma cell proliferative disease usually seen in men of Mediterranean descent, characterized by intestinal involvement with steatorrhea, often progressive with fatal outcomes, or pertaining to alpha thalassemia, a genetic abnormality in the alpha globin chain of hemoglobin. Alpha chymotrypsin-induced glaucoma. Transient secondary glaucoma following the use of alpha chymotrypsin in cataract intracapsular extraction. Alpha cortisol, a reduction product of cortisone present in urine, differing from cortisone in that the 3 keto groups are reduced to hydroxyls. Alpha cortisone, the 5-beta enantiomer of alpha allocortisone, a reduction product of cortisone present in the urine, differing from cortisone in that two of the keto groups at positions number 3 and 20 are reduced to hydroxyls. Alpha-D-galactosidase, an enzyme catalyzing the hydrolysis of alpha-D-galactosides to release free D-galactose. A deficiency of type A alpha-D-galactosidase is associated with Fabry disease. Is that right? Fabry disease. Yes. Alpha-D-glucosidase is a maltase, a glucohydrolase, removing terminal non-reducing 1,4-linked alpha-glucose residues by hydrolysis yielding alpha-glucose. It's also a deficiency in this lysosomal enzyme is then associated with glycogen storage disease type 2. At least 5 isozymes of maltase currently exist. Alpha-dextrin endo 1,6-glucosidase, an enzyme with action similar to that of isoamylase. It cleaves 1,6-alpha-glucosidic linkages in pulalan, amylopectin, and glycogen, and in alpha and beta amylase, limit dextrins of amylopectin and glycogen. AE amputation, above the elbow amputation acronym. Alpha-farnesene, a straight open-chain hydrocarbon built up of 3 isoprene units, one of 4 isomeric forms that occurs in natural coating of apples. Alpha-fucosidase, an enzyme that catalyzes the hydrolysis of alpha-L-fucoside, producing an alcohol and L-fucose. A deficiency of the lysosomal enzyme will result in fucosidosis. Alpha-glucosidase inhibitor, an oral agent that aids the control of diabetes mellitus by delaying the absorption of glucose from the digestive system. Alpha heavy chain disease, the most common form of a heavy chain disease, characterized by finding in the serum of a protein reactive with anti-sera to alpha chains, but not light chains. Clinical features include diarrhea, steraturia, and severe malabsorption. Alpha hemolytic streptococci, streptococci that form a green variety of reduced hemoglobin in the area of the colony on a blood agar medium. AK amputation, acronym for above the knee amputation. Alpha-keto acid dehydrogenase, one of several distinct multi-enzyme complexes that catalyze the formation of an acyl-CoA derivative, carbon dioxide and NADH from alpha-keto acid, NAD+, and coenzyme A. It's also a maple syrup urine disease that results from several different inherited defects in the mitochondrial branch chain alpha-keto acid dehydrogenase complex. Alpha-keto decarboxylase, formerly the enzyme system converting pyruvate, a 2-oxo acid, to acetyl-CoA and carbon dioxide with reduction of NAD+ to NADH, and the participation of lipoamide and thiamine pyrophosphate, now known to involve at least 3 enzymes in succession. Alpha-ketoglutamic acid, a metabolite of glutamine formed by the action of glutamine aminotransferase, elevated in certain cases of hepatocoma. Alpha-ketoglutarate, a salt or ester of alpha-ketogluteric acid. Alpha-ketoglutarate dehydrogenase, an enzyme that catalyzes the oxidative decarboxylation of 2-ketogluteric acid to succinyl dihydrolipoate. The succinyl group is later transferred to CoA, and the reduced lipoate is oxidized to NAD+. It's also defined as a complex that is part of the tricarboxylic acid cycle. Alpha-ketosuccinamic acid, the transamination product of asparagine, acted upon by alpha-amidase. Alpha-L-iduronidase, an enzyme that hydrolyzes terminal desulfated alpha-L-iduronic acid residues of dermatan sulfate and of heparan sulfate. A deficiency of this enzyme is associated with Hurler syndrome, and Shy syndrome, the latter being the mildest form of mucopolysaccharidosis type 1, a rare lysosomal storage disease characterized by skeletal deformities and a delay in motor development. A mode. In diagnostic ultrasound, a one-dimensional presentation of a reflected sound wave in which echo amplitude A is displayed along the vertical axis and echo delay depth along the horizontal axis. The echo information derives from tissue interfaces along a single line in the direction of the described sound beam. Alpha-naphthalthiourea, a derivative of thiourea, a highly toxic anti-thyroid agent, especially to small mammals, causing pulmonary edema, fatty degeneration of the liver, and low body temperature. Thus, it is used as a rat poison. APC, abbreviation for adenoidal pharyngeal conjunctival, also an abbreviation for antigen-presenting cell. A-pattern esotropia, convergent strabismus greater in upward than in downward gaze. A-pattern exotropia, divergent strabismus greater in downward than in upward gaze. Alpha-ribosol, the benzimidazole nucleoside in vitamin B12. Alpha-sarsen, a fungal toxin that acts on the large subunit of rRNA and inactivates the ribosome. A strabismus, strabismus in which esotropia is more marked in looking upwards than downwards, also defined as a strabismus in which exotropia is more marked looking downwards as compared to upwards. Alpha-tocopherol, one of the several forms of vitamin D, a light yellow, viscous, odorless, oily liquid that deteriorates on exposure. It's obtained from wheat germ oil or by synthesis. Biologically exhibits the most vitamin E activity of all of the tocopherols. It's an antioxidant that slows the rancidity of foods by interfering with the oxidation of fats. AV shunt, an arteriovenous shunt. AV strabismus syndrome. Strabismus, in which the angle of deviation is more marked on looking upwards than downwards. AV valves, abbreviation for the cardiac atrioventricular valves, most notably the mitral and the tricuspid valves. ABC process, purification of water or deodorization of sewage by a mixture of alum, blood, and charcoal. AC, abbreviation for Latin antecebum, before a meal, or antecebos, before meals. AD, abbreviation for Latin oris dextra, the right ear. AS, abbreviation for Latin oris sinistra, left ear. AU, abbreviation for Latin oris ultrac, each ear or both ears. AT cloning, cloning of fragments in which the only overhanging or uncomplemented ends are the adenine or the thymine bases, occurs often in use of specific enzymes to cut or make DNA fragments. Alpha-1 antitrypsin deficiency, absence of a serum proteinase inhibitor that may cause relapsing nodular suppurative panniculitis. Alpha-1 antitrypsin deficiency panniculitis, multiple painful subcutaneous nodules occurring in patients with severe antitrypsin deficiency. Biopsies show lobular panniculitis with neutrophils and foamy histiocytes. Some patients formerly diagnosed with Weber-Christian disease commonly show this deficiency. Alpha-1 lipoprotein, a lipoprotein or a fat amino acid chain of relatively low molecular weight, high density, and rich in phospholipids. It's found in alpha-1 globulin fraction of human plasma. Alpha 2 thalassemia is formerly known as beta thalassemia, heterozygous state. Alpha 2 neuroaminoglycoprotein, a glycoprotein that is a sugar with amino acid chains that contains neuraminic acid and that during electrophoresis migrates to the alpha 2 portion of serum proteins. AAA, abbreviation for abdominal aortic aneurysm. AAA disease, an endemic anemia of ancient Egypt, ascribed in ancient papyrus as an intestinal infestation with ankylostoma, now formally called ankylostomiasis. AAD, abbreviation for alpha amino adipic acid. Iogenes syndrome, an idiopathic form of familial intrahepatic cholestasis associated with lymphedema of the lower extremities. AAMC, abbreviation for American Association of Medical Colleges. AAR, abbreviation for antigen-antibody reaction. Aaron, referring to Charles D. Aaron, U.S. physician, born 1866, died 1951. The Aaron sign. In acute appendicitis, a referred pain or feeling of distress in the epigastrium or precordial regions on continuous firm pressure over the McBurney point. Aarskog-Scott syndrome, a fascio-digitogenital dysplasia. Fascio-digitogenital dysplasia, right? Yes. ASH, AASH, abbreviation for adrenal androgen stimulating hormone. AAV, abbreviation for adeno-associated virus. Ab initio, meaning from the beginning. Ab, prefix meaning from, away from, off. It's also a prefix applied to electrical units in the CGS electromagnetic system to distinguish them from units in the CGS electrostatic system. Prefix there is stat, and those in the metric system or SI units have no prefix. SI units have no prefix. Abady sign of tabes dorsalis, insensibility to pressure over the tendo Achilles. Ab ampere, electromagnetic unit of current equal to 10 absolute amperes, a current that exerts a force of 2 pi dynes on a unit magnetic pole at the center of a circle of wire 1 centimeter in radius. Abapical, opposite of the apex. Abapical pole in an oocyte, the pole opposite to the animal pole, which is the vegetal pole. Aberonosis, loss of ability to appreciate the weight of objects held in the hand or to differentiate amongst objects of different weights, when the primary senses are intact, caused by a lesion of the contralateral parietal lobe. Abasia, inability to walk. A basic, affected by or associated with an inability to talk, also defined as referring to the loss of pyrimidine sites inside DNA. Abatement, a diminution or easing, also defined as a reduction, ultimately elimination of public health nuisances such as smoke or loud noise. Abaxial, 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 lying outside the axis of any body part, also defined as situated at the opposite extremity of the axis of a part. Abbey condenser, a system of 2 or 3 wide-angle achromatic convex and plano-convex lenses that may be moved upward or downward beneath the stage of a microscope, thereby regulating the concentration of light directly from a bulb or reflected from a mirror that passes through the material to be examined on stage. Abbey flap, triangular wedge of the lower lip usually midline, transferred to the upper lip and vascularized by the labial artery. Abbott, referring to W. Osler Abbott, U.S. physician, born 1902 and died tragically at the age of 41, 1943. Abbott artery, an anomalous artery arising from the posteromedial proximal descending aorta, important during coarctation repair. Abbott strain for spores. Abbott strain, Abbott stain. Abbott stain for spores. Spores are stained blue with alkaline methylene blue. Bodies of the bacilli then become pink with the eosin counterstain. ABC leads, the leads for recording one kind of vector cardiogram utilizing the Arrighi triangle, supplanted by XYZ leads. ABC transporter proteins, a superfamily of carrier proteins that bind two highly conserved ATP binding cassettes and function in transporting peptides, sugars, polysaccharides, and ions across the cell membrane. Mutations in the gene that codes for one of these ABC transporter proteins is believed to be responsible for cystic fibrosis. Coulomb, a unit of electrical energy equal to 10 coulombs, the charge that passes over a given surface in 1 second if a current of 1 ampere is flowing across the surface. Abdomen, the part of the trunk that lies between the thorax and the pelvis. The abdomen does not include the vertebral region posteriorly, but is considered by some anatomists to include the pelvis and the abdominopelvic cavity. It includes part of the greater part of the abdominal cavity, cavitus abdominis is what it would be called, and is divided by arbitrary planes into 9 different regions. Abdomen obstipum, obsolete, rarely used term for the deformity of the abdomen due to congenitally short rectus muscles. Abdominal, relating to the abdomen. Abdominal, relating to the abdomen. Abdominal angina, intermittent abdominal pain, frequently occurring at a fixed time after eating, caused by inadequacy of the mesenteric circulation, resulting from arteriosclerosis or other arterial diseases. Abdominal aorta, the part of the descending aorta that is distal, inferior, to the aortic hiatus of the diaphragm, which occurs at the T12 vertebral level. Abdominal aortic nerve plexus, an autonomic plexus surrounding the abdominal aorta, continuously directed with the thoracic aortic plexus superiorly and continuing inferiorly to the bifurcation of the aorta as the superior hypogastric plexus. Abdominal apoplexy, mesenteric hemorrhage, thrombosis, or embolus involving the mesenteric or abdominal blood vessels. Abdominal aura, epileptic aura characterized by abdominal discomfort, including nausea, malaise, pain, and hunger. Some phenomena reflect ictal autonomic dysfunction. Abdominal ballottement, palpation of the abdomen to detect excessive amounts of fluid. Ascites, by causing organs to bob up and down in the fluid milieu. Abdominal cavity, the space bounded by the abdominal walls, the diaphragm, and the pelvis. It usually is arbitrarily separated from the pelvic cavity by the plane across the superior aperture of the pelvis. However, it may include the pelvis with the abdomen. See the definition for abdominopelvic cavity. Within the cavitus lie the greater part of the organs of digestion, the spleen, the kidneys, and the suprarenal glands. Abdominal compartment syndrome, a constellation consisting of cardiovascular, pulmonary, and renal compromise produced by increased intra-abdominal pressure from bleeding, intra-abdominal or retroperitoneal ileus, peritonitis, or insufflation. Abdominal fissure, congenital failure of the ventral body wall to close. Abdominal fistula, a fistulous passage connecting one of the abdominal viscera to the external surface. Abdominal guarding, a spasm of abdominal wall muscles detected on palpation to protect inflamed abdominal viscera from pressure, usually a result of inflammation of the parietal peritoneal surface, as in appendicitis, diverticulitis, or generalized peritonitis. Abdominal hernia, a hernia protruding through or into any part of the abdominal wall. Abdominal hysterectomy, removal of the uterus through an incision in the abdominal wall. Abdominal hysteroplexy, attachment of the uterus to the anterior abdominal wall. Abdominal hysterectomy, transabdominal incision into the uterus. Abdominal lymph nodes, the parietal and visceral lymph nodes of the abdomen collectively. Abdominal migraine, migraine in children accompanied by paroxysmal abdominal pain. This must be distinguished from similar symptoms requiring surgery and surgical attention. Also a disorder that causes intermittent abdominal pain and is believed to be related to migraine, also defined as abdominal migraine as some of the features of a migraine. There may be strong familial history of migraine headaches, and the condition may be relieved by sleep. However, a headache may or may not be present. The diagnosis depends on excluding other causes of abdominal pain. Abdominal muscle deficiency syndrome, congenital absence, either partial or complete, of abdominal muscles in which the outline of the intestines is visible through the protruding abdominal wall. In men, the genitourinary anomalies, the urinary tract dilation, and cryptorchidism are also found. The genetics of the disease are unclear. Abdominal myomectomy, removal of the myoma of the uterus through an abdominal incision. Abdominal nephrectomy, transperitoneal removal of the kidney by an incision through the anterior abdominal wall. Abdominal ostium of uterine tube, the fimbriated or ovarian extremity of an oviduct. Abdominal part of the esophagus, the portion of the esophagus from where it passes through the diaphragm to where it enters the stomach. Abdominal part of pectoralis major, portion of pectoralis major originating from the rectus sheath. Abdominal part of peripheral autonomic plexuses and ganglia. Portion of the autonomic nervous system, which is defined as networks composed largely of autonomic nerve fibers, but also including visceral afferent fibers and ganglia associated with blood vessels and organs that occur in both retro and intraperitoneally in the abdominal cavity. The abdominal part of the thoracic duct, the part of the thoracic duct between the cisterna chyli and the aortic hiatus of the diaphragm. Abdominal part of the ureter, the part of the ureter between the renal pelvis and the brim of the pelvis. Abdominal pool, the volume of blood within the abdomen. Abdominal pregnancy, the implantation and development of the ovum in the peritoneal cavity, usually secondary to an early rupture of a tubule pregnancy, very rare. Primary implantation may occur in the peritoneal cavity. The blastocyst commonly implants in the rectouterine pouch of the peritoneum. Abdominal pressure is the pressure surrounding the bladder, estimated from rectal, gastric, or intraperitoneal pressure. Abdominal pulse, the soft, compressible aortic pulse occurring in certain abdominal disorders. Abdominal reflex, contraction of the muscles of the abdominal wall on stimulation of the skin, superficial or reflexes, or tapping on neighboring bony structures, deep reflexes. Abdominal regions, topographic divisions of the abdomen as bounded by the vertical mid-clavicular lines and the horizontal transpyloric and interspinous lines. The dictionary had an illustration for that. Abdominal respiration, breathing affected, breathing affected mainly by the action of the diaphragm. Very deliberate. Abdominal sac, the part of the embryonic coelom that becomes the abdominal cavity. Abdominal salpingectomy, removal of one or both uterine tubes through abdominal incision. Abdominal salpingectomy, also as the incision into the uterine tube through an opening in the abdominal wall. Abdominal testes, an undescended testes that has never descended from the retroperitoneal abdominal origin through the internal inguinal ring. Abdomino, combining form indicating abdomen. It's a prefix, abdominal. Abdominocardiac reflex. Mechanical stimulation, it's usually distension of abdominal viscera, causing changes, usually a slowing in the heart rate or occurrence of extrasystoles. Abdominocentesis, a paracentesis of the abdomen. Abdominogenito, relating to the abdomen and the genitals. Abdominopelvic, relating to the abdomen and the pelvis, especially combined abdominal and pelvic cavities. Abdominopelvic cavity, the combined and continuous abdominal and pelvic cavities. Abdominopelvic splanchnic nerves, visceral branches of sympathetic trunks conveying presynaptic sympathetic fibers to and visceral afferent fibers from the prevertebral ganglia and plexuses for the innervation of viscera located below the diaphragm. The greater, lesser, lowest, lumbar, and sacral splanchnic nerves belong to this group. Abdominoperineal, relating to both the abdomen and the perineum, as in abdominoperineal resection of the rectum. Abdominoperineal resection, a surgical cancer treatment involving resection of the lower sigmoid colon, rectum, and surrounding skin and formation of sigmoid colostomy, performed as a synchronous or sequential transabdominal and perineal procedure. Abdominoplasty, an operation performed on the abdominal wall for cosmetic purposes. Abdominoscrotal, relating to the abdomen and, you guessed it, the scrotum. Abdominothoracic, relating to the abdomen and the thorax. Abdominothoracic arch, a bell-shaped line defined by the lower end of the sternum and the costal arches on each side, constituting a boundary line between the anterolateral portions and the thoracic and abdominal walls. Abdominovaginal hysterectomy, a combined vaginal and abdominal surgical dissection that allows partial, complete removal of the vulva, rectum, and perineum, as well as pelvic organs, usually done in cases of advanced pelvic cancer. Abdominovesical, relating to the abdomen and the urinary bladder, or to the abdomen and the gall bladder. Abducens nucleus, a group of motor neurons in the lower part of the pons, innervating the ipsilateral lateral rectus muscle of the eye, unique among motor cranial nerve nuclei in that it consists of two distinct populations of neurons. Abducent, abducting, drawing away, especially away from the median plane. Abducent nerve, also known as cranial nerve number 6, a small motor nerve supplying the lateral rectus muscle of the eye. Its origin is in the facial colliculus of the tegmentum of the pons just below the surface of the rhomboid fossa. It emerges from the brain in the fissure between the medulla oblongata and the posterior border of the pons, medullopontine sulcus. It enters, can't even say regular words now. It enters the dura of the clevis and passes through the cavernous sinus, entering the orbit through the superior orbital fissure. Abduct, to move away from the median plane. Abduction, movement of a body part away from the median of the body, median plane of the body, in case of the limbs or the hand and the foot, or in case of the digits. Also defined as a monoocular rotation, duction of the eye towards the temple. I'm not going to go cross-eyed for that. It's also defined as a position resulting from such a movement. The abductor is a muscle that causes movement away from the median plane of the body, axis of the middle finger, or axis of the second toe, or in the case of the thumb, anterior to the plane of the palm. Abductor digiti minimi of the foot, muscle of the first layer of plantar muscles. Origin, lateral and medial processes of calcaneal tuberosity. Insertion, lateral side of proximal phalanx of the fifth toe. Action, abducts and flexes little toe. Nerve supply comes from the lateral plantar nerve. The abductor digiti minimi of the hand. Superficial, hypothenar muscle of the palm. Origin, pisiform bone and pisohamate ligament. Insertion, medial side of base of proximal phalanx of the little finger. Action is that it abducts and flexes the little finger. Nerve supply comes from the deep branch of the ulna. Abductor hallucis, muscle of the third layer of plantar muscles. Origin comes from the medial processes of calcaneal tuberosity, flexor retinaculum, and the plantar aponeuroses. Insertion into the medial side of proximal phalanx of the great toe. This is not my foot. Action, abducts the great toe. Nerve supply comes from the medial plantar nerve. Medial plantar nerve. Abductor pollicis brevis, superficial thenar muscle. Origin comes from the tubercle of the trapezium and flexor retinaculum. Insertion into the lateral side of the proximal phalanx of the thumb. Action, it abducts the thumb. Nerve supply, the median nerve. Abductor pollicis longus, outcropping muscle of the posterior compartment of the forearm. Origin, the interosseous membrane and posterior surfaces of radius and ulna. The insertion is from the lateral side of the base of the first metacarpal bone, and the action is that it abducts and assists in extending the thumb. Nerve supply is the radial nerve. Abductor spasmodic dysphonia, a breviform of dysphonia caused by long and excessive vocal fold opening for voiceless phones extending into vowels. Abegg, Richard, Danish chemist. Richard Abegg, Danish chemist, 1869 to 1910. Abeg rule, the tendency of the sum of maximum positive and negative valences of a particular element to equal the number 8. C, carbon may have a valence of +4 or also -4. O, sometimes +6, but also -2. Sometimes loosely stated as all atoms have the same number of valences, a consequence of the tendency of valence electron shells to be filled to the number 8. Abel-Kendall method, a standard reference method for the estimation of total serum cholesterol involving saponification of cholesterol ester by hydroxide, extraction with petroleum ether, and color development with acetic anhydride sulfuric acid. The method avoids interference by bilirubin, protein, and hemoglobin. Abelson, referring to Herbert T. Abelson, 20th century U.S. pediatrician. Abelson-Murine leukemia virus, a retrovirus belonging to the type C retrovirus group family Retroviridae, that is associated with leukemia and induces in vitro transformation of certain mouse cells. That is a very lackluster definition. Why did I remember that? Okay, abembryonic. No. The area of blastocysts opposite the region where embryoblast, the early embryo, is located. Abembryonic pole. The pole of the blastocyst opposite the embryonic pole where the embryoblast, primordial embryo, is located. Abenteric, nearly obsolete term. We don't use it ever anymore. Away from the intestine, said of a morbid process occurring elsewhere that would normally occur in the intestine. Don't know if we want to know what that is. Abernethy John Abernethy, a British surgeon and anatomist, 1764 to 1831. Abernethy fascia, a layer of subperitoneal areolar tissue in front of the external iliac artery. Aberrant, differing from the usual or the norm. In botany or zoology, it's used for certain atypical individuals in a species. Abnormal, it's also defined as a wandering off, used to describe certain ducts, vessels, or nerves that deviate from the usual or normal course or pattern, also referring to genetic makeup and used in oncology. Aberrant artery, artery having an unusual origin or a course. Aberrant bile ducts, something you don't want. Small ducts occasionally present in the ligaments of the liver or originating from the surface of the liver. Aberrant bundles, a group or groups of fibers from the corticobulbar or corticonuclear tract directed to each of the motor nuclei of the cranial nerves. Aberrant complex, an anomalous electrocardiographic complex. More specifically, an abnormal ventricular complex caused by abnormal intraventricular conduction of a supraventricular impulse. Aberrant ductules, the superior or inferior diverticula of the epididymis. Aberrantia. Aberrant ganglion. Another thing you don't want, a collection of nerve cells sometimes found on a posterior spinal nerve root between the spinal ganglion and the spinal cord. Aberrant goiter, yet another thing you don't want, enlargement of a supernumerary thyroid gland. And if you have one, you should see somebody for it. Aberrant hemoglobin, a mutant hemoglobin that functions abnormally. Aberrant hepatic artery, relatively common accessory or replaced right or left hepatic artery, although many varieties exist. The most common source of an aberrant right hepatic artery is the superior mesenteric artery. The most common source of an aberrant left hepatic artery is the left gastric artery. Aberrant obturator artery, also known as the accessory obturator artery, public branch of the inferior epigastric artery. Aberrant regeneration, a misdirected regrowth of nerve fibers, seen, for example, after oculomotor nerve injury. Aberrant ventricular conduction, abnormal intraventricular conduction of a supraventricular beat where surrounding beats are normally conducted. Aberration, deviation from the usual or normal course or pattern. It's also deviant development or growth. A barometer, an instrument for measuring optic aberration in any experiment and the errors within that experiment. A beta lipoproteinemia, a disorder caused by an absence of low-density beta lipoprotein. Presence of acanthocytes in blood, retinal pigmentary degeneration, malabsorption, engorgement of upper intestinal absorptive cells with dietary triglycerides, and neuromuscular abnormalities. Autosomal recessive inheritance caused by mutation in the gene encoding microsomal triglyceride transfer protein, MTP, on chromosome 4q. Abeyance, a state of temporary cessation of function. Abfarad, electromagnetic unit of capacity equal to 109 farads. Abfraction, to break away. Abfraction lesion, loss of tooth structure, usually in a wedge-shaped pattern in the cervical area of the tooth, attributed to flexure and fatigue in an area away from the point of loading, usually cervical. ABG, abbreviation for arterial blood gas. Ab-Henry, electromagnetic unit of induction equal to 10·9 Henry. Ability, the physical, mental, or legal competence to function. Abiotic, incompatible with life. Also defined as a with meaning without, biotic meaning pertaining to life. Abiotrophy, an age-dependent manifestation of a genetically determined trait. Abiraterone acetate, an inhibitor of 17-alpha hydroxylase, C1720 lyase, an enzyme involved in androgen synthesis used in the treatment of advanced prostate cancer. Aberration, obsolete term for diminution or getting rid of the irritability of a part. Why am I defining words that don't even matter? Able, very important. An oncogene found in the Abelson strain of mouse leukemia virus involved in the Philadelphia chromosome translocation in chronic granulocytic leukemia. Ablastemic, not germinal or blastemic. Ablastin, an antibody that seems to inhibit reproduction of trypanosomes found in rats infected with Trypanosoma lewisii. Ablate, to remove or to destroy the function of. Ablation, removal of a body part or destruction of its function by a surgical procedure or a morbid process, or the presence or application of a noxious substance. ABLB, abbreviation for alternate binaural loudness balance. It is a test. Ablepharia, congenital absence of the eyelids. Abluent, cleansing, also defined as anything with cleansing property. Ablution, an act of washing or bathing. Abnerval, away from the nerve, denoting specifically a current of electricity passing through a muscle fiber in a direction away from the point of entrance of that muscle fiber. Abneural, away from the neural axis. Abnormal, not normal, differing in any way from the usual state, structure, condition, or rule. Abnormal cleavage of the cardiac valve. congenital malformation of a valve leaflet with a defect extending from the free margin. Abnormal neurulation, failure of closure of parts of that neural tube that produces neural tube defects such as spinal bifida cystica. Abnormal occlusion is defined as an arrangement of teeth that is not considered to be within the normal range of variation. Abnormality, the state or quality of being abnormal. Ab meaning without, and normal meaning being like the average in a Gaussian distribution. Also defined as an anomaly, deformity, malformation, impairment, or a dysfunction. ABO, symbol for the blood group systems, under systems, blood typing systems. ABO, hemolytic disease of the newborn. Erythroblastosis fetalis, resulting from maternal fetal incompatibility with respect to the antigen of the ABO blood group. The fetus possesses A or B antigen, or both, that is lacking in the mother, and the mother produces an immune antibody that causes hemolysis of fetal erythrocytes. Ab-ohm, electromagnetic unit of resistance equal to 10 to 9 ohms. Ab-orad, in a direction away from the mouth, opposite of the orad. Aborted systole, a loss of systolic beat in the radial pulse through weakness of the ventricular contraction. Abortive transduction, transduction in which the genetic fragment of the donor bacterium is not integrated in the genome of the recipient bacterium, and when the latter divides, it's transmitted to only one of the daughter cells. ABP, pronunciation or abbreviation for androgen binding protein. ABPA, abbreviation for allergic bronchopulmonary aspergillosis. ABR, abbreviation for auditory brainstem response. Abrachia, congenital absence of arms. Abrachiocephaly, congenital absence of arms and head. Abrade, to wear away by mechanical action, also defined as to scrape away part or all of the surface layer from a particular part. Abrahams, referring to Robert Abrahams, a U.S. physician born in 1861, died 1935. The Abraham sign, earlier appreciation of abnormal pulmonary auscultatory signs over the distal clavicle than the apex, suggesting apical tuberculosis, also defined as a diminished percussive resonance over the pulmonary apex in advancing tuberculosis. Abrams, referring to Albert Abrams, the U.S. physician born 1863, died 1924. Abrams heart reflex, a contraction of the myocardium when the skin of the precordial region is irritated. Abrasion, an excoriation or circumscribed removal of the superficial layers of skin or the mucous membrane, also defined as a scraping away of a portion of the surface. Also defined in dentistry, the pathologic grinding, or wearing away of tooth substance by incorrect tooth brushing methods. The presence of foreign objects, bruxism, or similar causes. Abrasive, causing an abrasion. Also defined as any material that's used to produce abrasions. Also defined as a substance used in dentistry for abrading, grinding, or polishing, usually referring to irritation. Abrasive strip, a ribbon-like piece of linen with bonded abrasive particles on one side, used in dentistry to contour and polish proximal surfaces of restorations. Abrasiveness, those properties of a substance that cause surface wear by friction, also defined as the quality of being able to scratch or wear away another material. Abreact, to show strong emotion while reliving a traumatic experience. also defined as to discharge or release a repressed emotion. Abreaction, in Freudian psychoanalysis, an episode of emotion release or catharsis associated with the conscious recollection of repressed, unpleasant experiences. Abrin, a phytotoxin from Jaquiridae seeds or Indian Glycyrrhiza, the red seeds, Abris precatorius, used in ophthalmology. Abruptio placentae, premature detachment of a normally situated placenta. Abruption, a tearing away, separation, or a detachment. Abris, a genus of leguminous plants. The root of Abris precatorius, Indian licorice, is sometimes used as a substitute for actual licorice. The seeds are toxic and they may cause vomiting, diarrhea, convulsions, and ultimately death. Abscess, a circumscribed collection of purulent exudate, frequently associated with the swelling of other signs and inflammation. It's also defined as a cavity formed by liquefactive necrosis within solid tissue. Abscess cavity, a cavity resulting from necrotizing infection recognized radiologically by its gas content. Abscissa, in a plane in Cartesian coordinates, the horizontal x-axis. Abscission means a cutting away. Absconsio, a recess, cavity, or depression used especially in osteology to denote a bony cavity that accommodates the head of another bone. Abscopal, denoting the effect that radiation of a tissue has on remote, non-irradiated tissue. Abscopal effect, a reaction produced following irradiation but occurring outside the zone of actual radiation absorption. Absence, absence, looks like absence, paroxysmal attacks of impaired consciousness, occasionally accompanied by spasm or twitching of cephalic muscles, which usually can be brought on by hyperventilation. Depending on the type of severity and of the absence, depending on the type and severity of the absence, the EEG may show an abrupt onset of a 3-second spike and wave pattern, as in simple absence, or in typical cases, a 4-second spike and wave or faster spike complexes. The clinical states accompanying these EEG abnormalities may be classified as an absence. An absence seizure is a seizure characterized by impaired awareness of interaction with or memory of ongoing events, external or internal to the person, may comprise of different elements. Absidia, a genus of fungi, family Mucorrhizaceae, commonly found in nature. Thermophilic species survive in compost piles at temperatures exceeding 45 degrees Celsius and may cause mucormycosis, also zygomycosis in humans. Absinthe, a liquor containing 60 to 75% ethanol flavored with absinthium, anise, fennel, and other herbs, long banned in the US and other countries because of its toxic effects and addictiveness. Formal definition. The active principle is thuone, absinthin, a bitter principle obtained from absinthium. Absinthium, the dried leaves and tops of Artemisia absinthium, family Compositae, now seldom used in the infusion formerly used as a tonic. In large and frequently repeated doses, it can produce heartache, headache, trembling, and epileptiform convulsions. Absolute is unconditional, unlimited, uncombined, undiluted, is in reference to alcohol. Also, absolute means certain. Absolute agraphia. Agraphia, which not even unconnected letters can be written. Some of these words don't, why? Absolute alcohol, 100% alcohol. Water having been removed. Also, alcohol with a minimum admixture of water at most, measured at 1%. Absolute cell increase, an actual increase in one of the types of leukocytes. The absolute number of leukocytes in 1 cubic millimeter of blood being obtained by multiplying the total leukocyte count by the percentage of cell types in question. Absolute dehydration, actual water deficit as measured by a difference from the normal or from a given water content. Absolute glaucoma, the final stage of blindness in glaucoma. Absolute hemianopia, a hemianopia in which the affected field is totally insensitive to all visual stimuli. Absolute humidity, the mass of water vapor actually present per unit of volume, usually talking of gas, and in our sense, we are talking about air. Absolute hydration, actual water excess, measured by a difference from the normal or from a given water content. Absolute hyperopia, manifest hyperopia that cannot be overcome by an effort of accommodation. Absolute intensity, threshold acuity, the minimum level of perceptible light. Absolute leukocytosis, an actual increase in the total number of leukocytes in circulating blood as distinguished from a relative increase such as that observed in dehydration. Absolute oils, essential oils that are obtained by the removal of insoluble compounds from concrete oils. Absolute pressure, pressure measured with respect to zero pressure. Absolute refractory period, the period following excitation which no response is possible regardless the intensity of the stimulus. Absolute risk, a probability that a specified event will occur in a specified population in contrast to the relative risk of the event. Absolute risk approach, a disease control method based on the observation that proportional risk reduction for absolute reductions in risk factors is independent the level of that risk factor. Absolute scale, obsolete term for the Kelvin scale. Absolute scotoma, a scotoma in which there is no perception of light. Absolute system of units, a system of measurement based on absolute units accepted as being fundamental, referring to length, mass, and time, and from which other units, force, energy, or work and power, are derived. Such systems are common use, the foot, pound, second, centimeter, gram, second, and meter, kilogram, second. Absolute temperature, a temperature that's measured in degrees Kelvin that starts at absolute zero. Absolute terminal innervation ratio, the number of motor end plates divided by the number of terminal axons related to them. Absolute threshold, the lowest limit of any perception. Absolute unit, the unit, the value of a unit of value which is consistent regardless of place or time and does not derive nor depend on gravitation. Absolute viscosity, force per unit area applied tangentially to a fluid, causing unit displacement of parallel planes separated by a unit distance. Units of measure in the centimeter, gram, second, or CGS system are termed poises. Absolute zero, the lowest possible temperature that at which the form of translational molecular motion constituting heat is assumed no longer to exist, as determined at negative 273.15 degrees Celsius, also known as 0 degrees Kelvin. Absorb, to take in by absorption, to merge into the bulk flow of the fluid. To reduce the intensity of transmitted light is the second definition for that. Absorbable gelatin film, a thin, sterile, non-antigenic, absorbable, water-insoluble thin sheet of gelatin prepared by drying a gelatin formaldehyde solution on plates. Used in the enclosure or the closure and repair of defects in membranes such as the dura mater and the pleura. Undergoes absorption over a period of 1 to 6 months. Absorbable gelatin sponge, a sterile absorbable water-insoluble gelatin-based sponge used to control capillary bleeding in surgical operations. It's left in situ and absorbed within 4 to 6 weeks. Absorbable surgical suture, a surgical suture material prepared from a substance that can be dissolved by the body tissues and is therefore not permanent. It's available in various diameters and tensile strengths. The rate of diminution of strength depends on the characteristics of that suture material. Absorbance, spectrophotometry, log of the ratio of the radiant power of the incident radiation to the radiant power of the transmitted radiation. Absorbed dose, the amount of energy absorbed per unit mass of a radiated material at the target site. In radiation therapy, the former unit for absorbed dose is the rad, 100 ergs per gram. The current SI unit, now we use the gray, 1 joule per kilogram, or 100 rad. Absorbafacient, causing an absorption, any substance that possesses the quality of being absorbent. Absorbent, having the power to absorb or soak up or incorporate a gas, liquid, light, rays, or heat. Also defined as any substance possessing such power. Also defined as a material used to remove carbon dioxide from circuits in which rebreathing occurs, anesthesia circuit, and basal metabolic equipment. Absorbent cotton, a cotton which has all the fatty matter extracted so that it readily takes up all of the fluids. Absorbent points, cones of paper or paper products used to dry or maintain medicaments during root canal therapy. Absorber head, portion of a rebreathing anesthesia circuit that contains carbon dioxide absorbent, often referred to as a canister. Absorptiometry. Absorptiometry is the measurement of absorption or of radiation. Absorption, the taking in, incorporation, or reception of liquids, gases, light, and heat. Also defined in radiology, the uptake of energy from radiation by the tissue or medium through which it passes. Third definition, removal of a particular antibody from a mixture on addition of a complementary antigen. Absorption band, the range of wavelengths or frequencies in the electromagnetic spectrum where radiant energy is absorbed by passage through a gaseous, liquid, or dissolved substance. It's exploited for analytical purposes in colorimetry or spectrophotometry, and it's usually described in terms of wavelength where maximum absorbance occurs. Lambda max. Absorption cell, a small glass chamber with parallel sides which absorption spectra of solutions can be obtained. Coefficient, absorption coefficient. Barking dogs. Absorption coefficient. The milliliters of a gas at standard temperature and pressure that will saturate 100 milliliters of liquid. Also defined as the amount of light absorbed in passing through 1 centimeter of a 1 molar solution of a given substance, expressed as a constant in the Beer-Lambert law. Also defined as a measure of the rate of decrease of intensity of an X-ray beam in its passage through a substance, resulting from a combination of scattering and conversion to other forms of energy. absorption collapse, pulmonary collapse due to rapid complete obstruction of a large bronchus, absorption fever, an elevation of temperature often occurring without other untoward symptoms shortly after childbirth, assumed to result from the absorption of uterine discharges through abrasions of the vaginal wall, absorption lines, the dark lines in the solar spectrum corresponding to wavelengths originally emitted by inner layers of the sun, but absorbed by various elements that are present in gaseous form in cooler layers and also in the Earth's atmosphere. Absorption spectrum, the spectrum observed after light has passed through and has been partially absorbed by a solution or a translucent substance. Many molecular groupings have characteristic light absorption patterns which can be used for detection and quantitative assay. Absorptive cells of the intestine, cells on the surface of villi or villi of the small intestine and the luminal surface of the large intestine that are characterized by the presence of microvilli on their free surface. Absorptivity, the material that can have the ability to absorb electromagnetic radiation. Abstinence, the refraining from certain behaviors. Abstinence syndrome, a constellation of physiologic changes undergone by people, also animals, who have become physically dependent on a drug or a chemical, who are abruptly deprived of that substance. The intensity of the syndrome varies with the drug or chemical. Generally, the effects observed are in opposite direction from those produced by the drug. The withdrawal syndrome from CNS depressants, for example, barbiturates, consists of insomnia, restlessness, tremulousness, hallucinations, and in the extreme, potentially fatal tonic-clonic convulsions. Onset time and severity of the syndrome depend on the rate at which the drug disappears from the body, often related to the half-life. Abstract, a preparation made by evaporating a fluid extract to a powder by triturating with milk sugar, also defined as a condensation or summary of a scientific or literary article or address. Abstract intelligence, the capacity to understand and manage abstract ideas and symbols. Abstract thinking, thinking in terms of concepts and general principles, perceiving a table and a chair as furniture as contrasted with concrete thinking. Abstraction, distillation or separation of the volatile constituents of a substance, also defined as exclusive mental concentration. Third definition, the making of an abstract from the crude drug. Fourth definition, malocclusion, in which the teeth or associated structures are lower than their normal occlusal plane. Fifth definition, the processes or the results of discernment, of formulation of general concepts from specific examples and or ascertainment of a given aspect of a concept from the whole. Abstriction, in fungi, formation of asexual spores by cutting off portions of the sporophore through the growth of dividing partitions. Ab-terminal, in a direction away from the end and towards the center, denoting the course of an electrical current inside of a muscle. Abulia, loss or impairment of the ability to perform voluntary actions or to make decisions, also defined as a reduction in speech, movement, thought, and emotional reaction, a common result of bilateral frontal lobe disease. Abulic, relating to or suffering from abulia. Abundance, the average number of types of macromolecules, or mRNAs, inside cells. Abuse, 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 misuse or wrongful use, especially excessive use of anything, also defined as injurious, harmful, or offensive treatments. Abutment, abutment, in dentistry, a natural tooth or implanted tooth substitute used to support or anchor a fixed or removable prosthesis. ABVD, abbreviation for a chemotherapy regimen of adriamycin, known as doxorubicin, bleomycin, vinblastine, and dacarbazine. Nobody uses it. We do use it. You don't want to use it. Sometimes you have to use it. Used in the treatment of Hodgkin lymphoma. Abvolt, the CGS electromagnetic unit of difference of potential equal to 8 to 10 volts. The potential difference between 2 points, such that 1 ERG of work will be done when 1 ab-coulomb of charge moves from point to point. Acacia, the dried gummy exudation of Acacia senegal and other species of acacia, prepared as a mucilage and syrup. It's used as an emollient, demulcent, excipient, and suspending agent in pharmaceuticals and foods, formerly used as a transfusion fluid. Acalculia, a form of aphasia characterized by the inability to perform simple mathematical problems, found with lesions of various areas of the cerebral hemispheres and often an early sign of dementia. Acampsia, rarely used term for stiffening or the rigidity of a joint for any reason. Acantha, a spine or spinous process, also defined as the spinous process of a vertebra. Acanthambiasis, infection by free-living soil and water amoebae of genus Acanthamoeba that may result in necrotizing dermal lesions, fulminating and usually fatal primary amoebic meningoencephalitis or subacute chronic granulomatosis amoebic encephalitis. Acanthamoeba, a genus of free-living amoeba found in and characterized by the presence of acanthropodia. Human infection usually includes the invasion of skin or colonization following injury, corneal invasion and colonization, and possibly lung or genitourinary tract colonization. A few cases of brain or CNS, central nervous system invasion, have occurred, but not solely by olfactory epithelium route of entry, as with more virulent infections caused by Naegleria fowli. Species responsible are chiefly Acanthamoeba culbertsoni, but cases have been reported involving Acanthamoeba castellani, Acanthamoeba polyphagia, and Acanthamoeba extranixis. Most cases have been chronic rather than fulminating and rapidly fatal with Naegleria fowli infection. Acanthamoeba medium, non-nutrient agar plates with an E. coli overlay to detect the presence of Acanthamoeba or Naegleria from tissue or soil samples. Acanthella, an intermediate larva stage of Acanthocephala, formed within the arthropod host, a pre-infective, non-encysted stage leading to infective cystacanth. Acanthesthesia, paresthesia of a pinprick. Acanthia lectularia, early name for Cimex lectularius. Acanthion, the tip of the anterior nasal spine. Acantho, a spinous process, spiny or thorny. Acanthocephala, the thorny-headed worms, a phylum, formerly considered a class of obligatory parasites without an alimentary canal, characterized by an anterior introvertible spiny proboscis. I don't do ID. They superficially resemble nematodes, but are cestode-like in other traits, and hence are grouped as distinctive phylum of helminths. In the early adult stage, they are parasites of vertebrate animals, mostly of fish and amphibians. The larval stage is passed in invertebrates, chiefly crustaceans and insects. Acanthocephalothiasis, an illness that's caused by an infection with a species of Acanthocephala. Acanthocyte, an erythrocyte that is characterized by multiple spiny cystoplasmic projections, as in acanthocytosis. Acanthocytosis, which is a rare disease in which most of the erythrocytes are acanthocytes, a regular feature of a beta-lipoproteinemia, also sometimes present in severe hepatocellular disease. Acanthoid, also known as spine-shaped. Acantholysis, a separation of individual epidermal keratinocytes from their neighbor, as in conditions such as pemphigus vulgaris and Darrier disease. Acanthoma, a tumor formed by proliferation of epithelial squamous cells. Acanthopodia, tooth-like pseudopodia observed in some amoebae, typically in members of the genus Acanthamoeba. Acanthor, the spindle-shaped embryo with rustellar hooks and body spines formed within the eggshell of Acanthocephala. This stage burrows into the body cavity in its first intermediate host, usually a crustacean inside aquatic cycles or insects in terrestrial cycles. Acanthosis, an increase in the thickness of the stratum spinosum layer of the epidermis. Acanthosis nigricans, an eruption of velvety, warty, benign growths and hyperpigmentation of the skin of the axilla, neck, and anogenital area, and groin. And in adults, it may be associated with an internal malignancy. It's also characterized from endocrine disorders, marked by insulin resistance or obesity, typically seen in type 2 diabetic patients in adolescence, and a benign hereditary type also commonly occurs in children. Acanthotic, pertaining to or characteristic of acanthosis. Acanthrocyte, an obsolete term for an acanthocyte. Acanthocytosis, an obsolete synonym for acanthocytosis. Acapnea, absence of carbon dioxide in the blood, sometimes used erroneously for hypocapnia. Acardia, congenital absence of the heart, a condition sometimes occurring in one member of monozygotic twins, or in one member of conjoined twins when one partner monopolizes the placental blood supply, and it can also occur in triplet pregnancies. Acardiac, without a heart. Acardias, a conjoined twin without a heart that remains viable by using the placental circulation of its mate. Usually other parts of the body are also absent. Acardias acephalus, an acardiac conceptus in which the head of the thoracic organs are absent. Ribs and vertebrae may be present and upper limbs are either absent or they are defective. Acardias amorphous, a shapeless product of conception covered by hair and skin. Acardias anceps, an acardias fetus with partly developed head and deformed face, trunk, and limbs. Acariasis, any disease that's caused by mites, usually a skin infestation. Acaricide, an agent that kills acarines, commonly used to denote the chemicals that kill ticks. Acarid, a general term for the member of the family Acardiae, or for a mite. Acardiae, a family of the order of Acarina, Acarina, a large group of exceptionally small mites, usually 0.5 millimeter or smaller, abundant in dried fruits, meats, grains, meal, and flour. Frequently, a cause of severe dermatitis among persons that are hypersensitized by frequent handling of infested products. Acarina, an order of arachnida that includes the mites and the ticks. Acarine, a member of the order of Acarina. Acarodermatitis, a skin inflammation or eruption that's produced in response to a mite. Acarodermatitis urticariotis, infestation with the grain itch mite, Pyomodes ventriculus, ventricosis, acarioid, resembling a mite, acarology, the study of acarine parasites and the diseases that they transmit, acariophobia, the morbid fear of small skin parasites, small skin particles, often resulting in a preoccupation with itching. Not to be confused with urticaria. Acarus, a genus of mites of the family Acardiae. Acarus ballatus, a tropical species of mite that causes particularly severe type of scabies-like irritation. Acarus hortii, the barley mite, a species that penetrates the skin. Acarus rhizoglypticus, hyacinthae. Acarus rhizoglyptus hyacinthae, a species of mite that develops in spoiled onions that can cause dermatitis. I'm going to knock that down. Acatalasia, absence or deficiency of catalase from the blood and the tissues, often manifested by recurrent infection or ulceration of the gingivae, also known as the gums, and related oral structures, and caused by mutations in the catalase gene on chromosome 11p. Homozygotes may have a complete absence, that's the Japanese variety, or very low levels, that's the Swiss variety of catalase. Heterozygotes have reduced catalase levels, hypocatalasia, which overlap within the normal range. Acathetic, rarely used term for acathexia. Acathexia, rarely used term for abnormal release of secretions. Acathexis, older but historically important term for a mental disorder in which certain objects or ideas fail to arouse an emotional response in the person. Acaudal, having no tail. ACC, abbreviation for anodal closure contraction. Accelerans, accelerating, also defined as an obsolete term for an accelerator, sympathetic nerve, to the heart. Accelerated, faster than usual progression of atherosclerotic vascular disease. Accelerated conduction. Any pathologically increased speed of conduction that usually occurs between the atrium and the ventricles, as in Wolff, Parkinson, White, and Lown-Genog-Levine syndromes. Such accelerated pathways provide for the basis of particular forms of re-entry tachycardia. Accelerated eruption, a dental eruption pattern that is chronologically advanced in comparison with the average pattern of dental eruption. Eruption of the first tooth occurs at an earlier age than the previous, and the periods between subsequent dental eruptions are shorter than the average. Accelerated hypertension. Hypertension advancing rapidly with increased blood pressure and associated with acute and rapidly worsening signs and symptoms. Accelerated reaction, a response occurring in a shorter time than expected. The cutaneous manifestations occurring during the period between the 2nd and the 10th days following smallpox vaccination. Because it is intermediate between a primary reaction and an intermediate reaction, it is regarded as evidence of some degree of resistance. Accelerated rejection, a transplant rejection manifested in less than 3 days. Acceleration, the rate of change in velocity per unit time, commonly expressed in units. Also expressed in centimeters, or feet per second squared. Also, the rate of increasing deviation from a rectilinear course. Accelerator, anything that increases rapidity of action or function. Alternate definition, in physiology, a nerve, muscle, or substance that quickens movement or response. Third definition, a catalytic agent used to hasten a chemical reaction. Fourth definition, in nuclear physics, a device that accelerates charged particles, protons, to high speed to produce nuclear reactions in a target, for the study of subatomic structure, for the production of radionuclides, or for radiation therapy. Accelerator fibers, post-ganglionic sympathetic nerve fibers originating in the superior, middle, and inferior cervical ganglia of the sympathetic trunk, conveying nervous impulses to the heart that increase the rapidity and the force of cardiac pulsations. Accelerator globulin. Globulin in serum that promotes the conversion of prothrombin to thrombin in the presence of thromboplastin and ionized calcium. Accelerator nerves, certain nerves of the cardiopulmonary splanchnic nerves, establishing the sympathetic innervation of the heart, originating from ganglion cells of the superior, middle, and inferior cervical ganglion of the sympathetic trunk. The unmyelinated efferent fibers of the accelerator nerves stimulate an increase of heart rate. Accelerin, an obsolete term for what was once considered an intermediary product of coagulation, but is thought no longer to exist. Accelerometer, an instrument for measuring the rate of change of velocity per unit of time. Accentuator, a substance such as aniline, the presence of which allows a combination between a tissue or a histologic element and a stain that might otherwise be impossible. Acceptor, a compound that will take up a chemical group such as an amine, a methyl, or a carbamoyl group from another compound, which would be known as the donor. Under the action of alanine transaminase, L-glutamate is an amine donor, whereas pyruvate is an amine acceptor. Also, second definition, a receptor that binds a hormone. Third definition, a drug-binding receptor that has no identified endogenase ligand. Acceptor site, the location of a ribosomal binding for the aminoacyl tRNA during protein synthesis. Excess persino, a series of severe attacks of falciparum malaria, sometimes occurring in apparently mild cases, roughly classified as cerebral and algid. Excess, a way or means of approach or admittance. Also defined as in dentistry, the space required for visualization and for manipulation of instruments to remove decay and prepare a tooth for restoration. Third definition, the opening in the crown of a tooth required to allow adequate admittance into the pulp space to clean, shape, and seal the root canals. Accessory, anatomy denoting structures, most notably muscles, arteries, nerves, glands, and others that are auxiliary, normally present, or supernumerary, anomalous, to another more typical or larger structure of the same type. Most often, accessory structures are duplication variations. Accessory adrenal, an island of adrenal cortical tissue separate from the adrenal gland, usually found in the retroperitoneal tissues, kidney, or genital organs. Accessory auricles, small fleshy nodules or folds, sometimes supporting cartilage, occasionally found among margins of embryonic pharyngeal grooves. Accessory branch of middle meningeal artery, a branch of either the middle meningeal or maxillary artery in the infratemporal fossa and passing superiorly through the foramen ovale to supply the trigeminal ganglion, dura mater, and inner table of the bone. Accessory breast, a milk-secreting gland located somewhere else rather than at the normal location at the front of the chest and existing in addition to the two usual mammae. Accessory canal. In the tooth, a channel leading from the root pulp laterally through the dentin to the periodontal tissue may be found anywhere in the tooth root, but is more common in the apical third of the root. Accessory cartilage, a sesamoid cartilage. Accessory cephalic vein, a variable vein that passes through the radial border of the forearm to join the cephalic vein near the elbow. Accessory chromosome, a supernumerary chromosome that is not an exact replica of any of the chromosomes in the normal cellular compartment. Accessory cunate nucleus, a cell group lateral to the cunate nucleus that receives posterior root fibers corresponding to the proprioceptive innervation of the arm and hand. It projects to the cerebellum by way of the cuneus cerebellar tract and can be considered the upper extremity equivalent of the thoracic nucleus. Accessory flocculus, an occasional small lobule of the cerebellum adjacent to the flocculus. Accessory gland, a small mass of glandular structure detached from but lying near another and larger gland, which it is similar in structure and probably similar in function. Accessory hemiazygous vein formed by the union of the 4th to 7th left posterior intercostal veins. It passes along the side of the bodies of the 5th, 6th, and 7th thoracic vertebrae, then crosses the midline posterior to the aorta, esophagus, and thoracic duct, and empties into the azygos vein, sometimes in common with the hemiazygos vein. Accessory lacrimal glands, small, compound, branched, tubular glands, sometimes located in the middle part of the lid, Wolf-Ring glands, 1872, or Chiachio glands, 1874, or along the superior or inferior fornices of the conjunctival sac. These accessory glands are ectopic portions of the lacrimal gland tissue, all produce the same kind of tears, secreting onto the conjunctival surface. Henle and Baumgarten glands are, in fact, not glands at all, but mere epithelial invaginations. Accessory lymph nodes, nodes of the lateral deep cervical group that are located along the accessory nerve. Their efferent vessels pass to the supraclavicular lymph nodes, accessory meningeal branch of middle meningeal arteries. Accessory molecules, surface receptors on immune cells, which participate in cell-to-cell interactions and modulate the immunologic outcome. For example, in T-cell recognition of B-cell presented antigen, the primary interaction occurs through CD3, CD4, binding to MHC and antigen, but this interaction is amplified if concomitant accessory molecule binding also occurs, CD8, CD28 to B7. Accessory nasal cartilages, variable small plates of cartilage located in the interval between the greater alar and lateral nasal cartilages. Accessory nerve trunk, part of the accessory nerve formed within the cranial cavity by the union of traditional cranial and spinal roots, which then divides within the jugular foramen and internal and external branches, the former uniting within the vagus, the latter exiting the foramen as an independent branch that is commonly considered to be the accessory nerve. The validity of the concept of a cranial root of the accessory nerve has been questioned, as well as the common existence of its trunk. Recent studies claim that the cranial root is always part of the vagus nerve. Accessory nerve, cranial nerve number 11, nerve that arises by two sets of roots. Accessory nipple, supernumerary nipple occurring on the mammary crest. Accessory nuclei of the optic tract. a small group of neuron cell bodies located along the trajectory of optic fibers in the mesencephalon. These consist of the posterior nucleus, medial nucleus, and the lateral nucleus, which are called the posterior, medial, lateral, terminal nuclei. The connections of these nuclei, along with the nucleus of the optic tract, make up the accessory optic system that appears to be concerned with the retinal slip in specific directions. Accessory obturator artery, a term that is applied to the anastomosis of the public branch of the inferior epigastric artery with the public branch of the obturator artery when it contributes a significant supply through the obturator canal in the presence of normal or reduced obturator arising from the internal iliac artery. Accessory obturator nerve, between L3 and L4 nerve fibers usually conveyed by the obturator nerve that comprise of a separate nerve running independently from the pectineus and the hip joint. Accessory olivary nuclei, also known as the dorsal accessory olivary nucleus and the medial accessory olivary nucleus. Accessory pancreas, a detached portion of pancreatic tissue, usually the uncinate process, part of the head of the pancreas, and hence most often found in the vicinity of the head, which may occur within the gut, sometimes the stomach or the duodenum. Accessory pancreatic duct, the excretory duct of the head of the pancreas from the proximal part of the duct of the embryonic dorsal pancreatic bud that opens independently into the duodenum at the lesser duodenal papilla. Accessory parathyroid gland, an additional or detached portion of a parathyroid gland, resulting in at least 5, but usually many more glandular units. Accessory parotid gland, an occasional islet of parotid tissue separate from the mass of the gland, lying anteriorly just above the commencement of the parotid duct. Accessory phrenic nerves, accessory nerve strands that arise from the 5th cervical nerve as often as the branches of the nerve to the subclavius, passing downwards to join the phrenic nerve. Accessory placenta, a mass of placental tissue distinct from the main placenta. Accessory process of lumbar vertebra, a small apophysis at the posterior part of the base of the transverse process of each of the lumbar vertebrae. Accessory root of the tooth, an anomalous additional tooth root. Accessory saphenous vein, an occasional vein running in the thigh parallel to the great saphenous vein, which it joins just before the latter empties into the femoral vein. Accessory sign, a finding frequently but not consistently present in a disease. Accessory spleen, one of the small globular masses of splenic tissue occasionally found in the region of the spleen in one or more of the peritoneal folds. Accessory structures, parts accessory to the main organ or structure. Accessory suprarenal glands, isolated, often minute masses of suprarenal tissue, sometimes found near the main glands or in the broad ligament or in the epididymis. Accessory symptom, a symptom that usually but not always accompanies a certain disease, as distinguished from a pathognomonic symptom, as distinguished from a pathognomonic symptom. Accessory thymic tissue, an isolated mass of tissue that arises from the thymus and enters the neck, often close to an inferior parathyroid gland. Accessory thyroid gland, an isolated mass, or one of several such masses of thyroid tissue, sometimes present in the side of the neck or ranging in position from just superior to the hyoid bone, the suprahyoid, accessory to the thyroid gland, to the arch of the aorta inferiorly. Accessory thyroid tissue, an isolated mass of tissue that arises from the developing thyroid gland and appears in the tongue or the thymus gland. Accessory tragus, small nodules present at birth, interior to the tragus, derived from first branchial arch, remnants, and often containing central cartilage. Accessory vertebral vein, a vein that accompanies the vertebral vein, but which passes through the foramen of the transverse process of the seventh cervical vertebra and opens independently into the brachiocephalic vein. Accessory structures, the eyelids with lashes and eyebrows, lacrimal apparatus, conjunctival sac, and extrinsic muscles of the eyeball. Accident, an unplanned or unintended but sometimes predictable event leading to injury in traffic, industry, or a domestic setting, or such an event developing in the course of a disease. Accident prone, experiencing a greater number of accidents that would be expected of the average person in similar circumstances, also defined as having personality characteristics predisposing one to accidents. Accidental host, host that harbors an organism that it usually does not infect. Accidental hypothermia, unintentional decrease in body temperature, especially in neonates, infants, and the elderly, particularly during surgery. Accidental murmur, an evanescent cardiac murmur resulting from causes of other than valvular lesions. Accidental myiasis, gastrointestinal myiasis from ingestion of contaminated food. Accidental symptom, any morbid phenomenon coincidentally occurring in the course of a disease but having no relation to it. Acclimating fever, elevated temperature with malaise that affects persons working in a very hot environment. Acclimation, physiologic adjustment of a person to a different climate, especially to a change in environmental temperature or geographic elevation. Accommodation, the act or state of adjustment or adaptation. Next definition, in sensory-motor theory, next definition, in sensory-motor neural theory, the alteration of a schemata or cognitive expectations to conform with experience. Accommodation of the eye, the increase in thickness and convexity of the eye's lens in response to ciliary muscle contraction to focus the image of an external object onto the retina. Accommodation of the nerve, the property of which a nerve slowly adjusts to increasing levels of stimulus so that its threshold of excitation is greater than it would be were the stimulus level to have risen more rapidly. Accommodation phosphene, a phosphene occurring during accommodation caused by sudden relaxation of the ciliary muscle. Accommodation reflex, increased convexity of the lens resulting in contraction of the ciliary muscle and relaxation of the suspensory ligament to maintain a distinct retinal image. Accommodative asthenopia, resulting from errors of refraction and excessive contraction of the ciliary muscle. Accommodative convergence, The meter angle of convergence expressed in diopters equal to the product of the meter angles of convergence multiplied by the interpupillary distance that is measured in the unit of centimeters. Accommodative convergence ratio. The amount of convergence that's measured in prism diopters of convergence divided by the amount of accommodation measured in diopters required to direct both eyes on an object. Accommodative insufficiency, a lack of appropriate accommodation for near focus. Accommodative strabismus, a strabismus in which the severity of deviation occurs with accommodation. Accomplice, a bacterium that accompanies the main infecting agent in a mixed infection that influences the virulence of the main organism. Accouchement, accouchement, childbirth, accouchement, childbirth, particularly partituration, accouchement forcé, forced, artificially hastened, fetal delivery, most commonly by means of version or of the forceps, originally applied to rapid dilation of the cervix, not dilatation but dilation of the cervix with hands, with version and forcible extraction of the fetus. Ecremenition, ecrementition, reproduction by budding or by germination. Accretio cordis, adhesion of the pericardium to the adjacent extracardiac sutures. Accretion, increase by the addition of the periphery of material to the same nature that is already present. The manner of growth of crystals, also defined in dentistry as the foreign material, usually plaque or calculus, collecting on the surface of a tooth. Third definition, a growing together. Accretion lines. Lines seen in microscopic secretions of the enamel, marking successive layers of added material. Accretionary growth, growth by an increase of intracellular material. Acrochage, intermittent synchronization of two different rhythms of the heart, with one influencing the behavior of when the other is neither dominant. Seen in cases of atrioventricular dissociation when an atrial beat falls shortly after a ventricular beat, the latter causing the atrial beat to occur sooner than expected. Accumulation analysis, a technique in which the intermediate of metabolic pathway accumulates because of selective inhibition of a particular step in that pathway, or in a mutant that is deficient in a certain step. The intermediate is then isolated, analyzed, and identified. Accumulation disease, a disease that's characterized by an abnormal accumulation of metabolic product in certain cells and tissues. Examples include the mucopolysaccharidosis and lipoidosis. Accuracy, the degree to which a measurement or an estimate based on measurements represents the true value of the attribute being measured. In the laboratory, accuracy of a test is determined when possible by comparing results from the test in question with results generated with a reference standard or an established reference method. ACD, an abbreviation for acid, citrate, and dextrose. ACE, ACE, abbreviation for angiotensin converting enzyme. ACE inhibitor, a class of drugs that block the conversion of angiotensin 1 to angiotensin 2 used in the treatment of hypertension and congestive heart failure, and in the prevention of microvascular complications of diabetes mellitus. Acedia, obsolete term for a mental syndrome, the chief features of which are listlessness, carelessness, apathy, and melancholia. ACE-I, the abbreviation for angiotensin-converting enzyme inhibitors. Acellular, devoid of cells. Second definition, a term applied to unicellular organisms that do not become cellular and are complete within a single cell unit, frequently applied to protozoans to emphasize their complete organization within a cell. Acellular cement, a type 1 collagen hard tissue that has neither cementocytes nor lacunae, that covers half of the coronal or 2/3 of the root of the tooth, usually covers the entire root of the incisors and of the canines. Acelom, acelom, absence of a true coelom, or a body cavity that's lined with mesothelium, typically found in platyhelminths, also known as flatworms, which have a syncytial mass of parenchymal cells instead of a true body cavity. Acelomate, not having a coelom or a body cavity. Acentric, lacking a center in cytogenetics, denoting a chromosome fragment without a centromere. Acentric, chromosome, a fragment of a chromosome lacking a centromere and unable to attach to the mitotic spindle, therefore unable to take part in the division of a nucleus and randomly distributed in daughter cells. Acephalalgic migraine, a classic migraine episode in which tachypsia is not followed by a headache. Acephaline, denoting members of the protozoan suborder Acephalina, characterized by a simple, non-compartmentalized body, which parasitizes invertebrates. Acephalocardia, absence of head and heart, as seen in a parasitic twin. Acephalochuria, congenital absence of head and hands. Acephalocyst, a cerile hyatid cyst, so called because it fails to develop tapeworm heads. Acephalogasteria, congenital absence of head, thorax, and abdomen as seen in a parasitic twin with pelvis and lower limbs only. Acephalopodgia, congenital absence of head and feet. Acephalorrhachia, congenital absence of head and a vertebral column. Acephalothoracia, congenital absence of a head and a thorax. Acephalus, headless. Acephalus, a headless fetus. Acephalus acormus, a condition in which a head without a body is attached to a placenta that is bound by the umbilical cord. Acephalus dibrachius, a fetus lacking a head but having two recognizably developed upper limbs. Acephalus deepus, a fetus lacking a head but having two recognizably developed lower limbs. Acephalus monobrachius, a fetus without a head and showing only one recognizable upper limb. Acephalus monopus, a fetus lacking a head with the fusion of the lower limbs so extreme that only a single foot is recognizable. Acephalus simpus, a fetus without a head and showing fusion of the lower limbs. Acephaly, congenital absence of the head. Acerola, fruit of a bushy tree that grows in South and Central America and Puerto Rico. The berry is the richest known source of vitamin C, also known as ascorbic acid. Acetostoma, exuberant granulations that form a cicatrix. Acet, combining forms denoting the 2-carbon fragment of acetic acid. Acetabula, plural of acetabulum. Acetabular, relating to the acetabulum. Acetabular branch, a arterial branch that supplies the acetabulum. 2 arteries, the obturator and medial femoral circumflex, have such branches. Acetabular fossa, depressed area in the floor of the acetabulum superior to the acetabular notch, bounded on all other sides by the lunate surface. Acetabular labrum, a fibrocartilaginous rim attached to the margin of the acetabulum of the hip bone. Acetabular margin, the rim of bone around the acetabulum to which is attached to the labrum acetabular notch, a gap in the inferior margin of the acetabulum bridged by the transverse acetabular ligament, given passage to the acetabular branches of the obturator artery and obturator vein. Acetabulectomy, the excision of the acetabulum. Acetabuloscopy, any operation aimed at restoring the acetabulum to as near a normal state as possible. Acetabulum, finally we're defining it, a cup-shaped depression on the external surface of the hip bone with which the head of the femur articulates. Acetal, product of the addition of 2 moles of alcohol to 1 mole of an aldehyde. In mixed acetals or glycosides, 2 different alcohols are bound to the original aldehyde group. Acetaldehyde is an intermediate in yeast fermentation of carbohydrate and in alcohol metabolism. It is a CNS toxin that arises from the metabolism of ethanol. Acetamide, an organic compound, organic being containing carbon, with a formula CH3CO2, C double bond O, CH3, C double bond O, NH2. It is the simplest amide derived from acetic acid. Acetaminophen, an antipyretic and analgesic with similar potency to that of aspirin, despite having a different mechanism of action related to paracetamol. Acetate, a salt or ester of acetic acid. Acetate kinase, a phosphotransferase forming acetyl phosphate and ADP from ATP and acetate, an important enzyme in formation of high-energy phosphate in certain microorganisms. Acetazolamide, the heterocyclic sulfonamide, 5-acetyl-amido-1,3-thiazole 2-sulfonamide, which inhibits the action of carbonic anhydrase in the kidney, increasing urinary excretion of sodium, potassium, and bicarbonate, reducing the excretion of ammonium, raising the pH of the urine, and lowering the pH of the blood. Used in respiratory acidosis and diuresis to stimulate respiratory drive in glaucoma, to reduce intraocular pressure, and in epilepsy. Oh, God. Acetic, denoting the presence of 2-carbon fragment of acetic acid, also relating to vinegar and meaning sour. Acetic acid, also known as vinegar, a product of the oxidation of ethanol and of the destructive distillation of wood. It's used locally as a counter-irritant and occasionally internally and also as a reagent. It is actually vinegar. Vinegar is a dilute solution of it. Acetic fermentation, a fermentation as of wine or beer whereby the alcohol is oxidized to acetic acid. Acetic solution, a vinegar. Acetic solution is used in a treatment of superficial bacterial infections, usually of the external auditory canal. Acetoceptor, side chain of molecules with a special affinity for acetic acid radical. Acetify is another word to cause acetic fermentation, to make vinegar or to become vinegar. Acetometer, an apparatus for determining the content of acetic acid in vinegar or in other fluids. Acetoacetate, a salt or ion of acetoacetic acid, a ketone body that is formed in ketogenesis. Acetoacetate decarboxylase, a carboxyliase, cleaving CO2 from acetoacetate to form acetone. Acetoacetic acid, one of the ketone bodies formed in excess and appearing in urine in starvation and in patients with diabetes. Acetoacetyl-CoA, intermediate in the oxidation of fatty acids and in the formation of ketone bodies. It's also formed from two molecules of acetyl-CoA in the degradation of ketogenic amino acids. Major role is condensation with acetyl-CoA to form beta-hydroxy beta-methyl-gluteryl-CoA. Acetoacetyl-CoA reductase, an oxidoreductase, catalyzing the conversion of a 3-oxoacyl-CoA and NADPH to the corresponding 3-D-hydroxyl-acyl-CoA and NADP+, a step in fatty acid synthesis. Acetoin, a condensation product of two molecules of acetaldehyde. Acetal, common term for 1-hydroxy-2-propanone or hydroxyacetone. Acetolysis, decomposition of an organic compound with the addition of the elements of acetic acid at the point of decomposition, analogous to hydrolysis and phosphorylasis. Acetone, a molecule. It's a colorless, volatile, flammable liquid. Extremely small amounts are found in normal urine, but larger quantities occur in the urine and blood of people that have diabetes, sometimes imparting an ethereal odor to the urine and breath. Acetone is one of the ketone bodies, and it is used as a solvent in many pharmaceutical and commercial preparations. Acetone fixative. Acetone used at low temperatures to fix enzymes, particularly phosphatases, and it removes fat and glycogen. Acetone test, a test for the presence of ketonuria. A sample of the urine is shaken up with a few drops of sodium nitroprusside, and a strong solution of ammonia is then gently poured over the mixture. If acetone is present, then a magenta ring forms at the line of contact. It's also defined as tablets containing sodium nitroprusside and alkali, which are not more commonly used now. Acetonemia, the presence or acetone of acetone bodies in relatively large amounts in the blood, manifested at first by excitability and later by a progressive depression. Acetonemic, relating to or caused by acetonemia. Acetonitrile, a colorless fluid of aromatic odor, soluble in water and in alcohol. Acetonuria, excretion in the urine of large amounts of acetone, an indication of incomplete oxidation of large amounts of lipids, commonly occurs in diabetic acidosis. Acetoaresin stain, a stain used for chromosomes in air-dried or squashed cytologic material. Acetose, relating to vinegar, meaning sour tasting. Aceto-whitening, blanching of skin or mucous membranes after application of 3 to 5% acetic acid solution, a sign of increased cellular protein and increased nuclear density, used particularly on genital skin and mucous membranes, including the uterine cervix, to identify zones of squamous cell change for biopsy, and condyloma ecumentanum of treatment. Aceturate, USAN approved contraction for N-acetylglycinate. Acetyl, an acetic acid molecule from which the hydroxyl group has been removed. Acetyl chloride, a colorless liquid used as a reagent, also corrosive, causing severe burns because of its hydrolysis to hydrochloric acid. Acetyl phosphate, a high-energy phosphate that acts as an acetyl donor in the metabolism of various bacteria. Acetyl value, the milligrams of potassium hydroxide required to neutralize the acetic acid produced by hydrolysis of 1 gram of acetylated fat, a measure of the hydroxy acids present in glycerides, most notably high in castor oil. Acetyl-CoA, a condensation product of coenzyme A and acetic acid, symbolized as CoA bound to C double bond O CH3, or as in acetyl-CoA. An intermediate in the transfer of 2 carbon fragments, most notably in the tricarboxylic acid cycle and used in fatty acid synthesis. Acetyl-CoA acetyltransferase, an acetyltransferase forming acetyl-CoA from 2 molecules of acetyl-CoA, releasing 1 CoA. The key step in ketogenesis and in sterol synthesis. Acetyl-CoA acyltransferase. It's an enzyme catalyzing the thioclastic cleavage of coenzyme A of beta-keto-acyl-CoA, forming an acyl-CoA with a carbon chain shorter by 2 atoms. The missing 2 atoms then appear as acetyl-CoA, a step in fatty acid degradation. Acetyl-CoA carboxylase, a ligase that catalyzes the reaction of acetyl-CoA, carbon dioxide, water, and ATP with covalently bound biotin to form malonyl-CoA, ADP, and P-phosphate, or the reverse decarboxylase. N-carboxybiotin is an intermediate, a crucial enzyme that's used in fatty acid synthesis. Acetyl-CoA hydrolase is a hydrolase that produces acetate and coenzyme A from acetyl-CoA. Acetyl-CoA glucosamine acetyltransferase is an enzyme that's involved in the synthesis of certain carbohydrate moieties on proteins. Deficiency of this enzyme leads to mucopolysaccharidosis type 3C. Acetyl-CoA ligase, a ligase that catalyzes the reaction of acetate and CoA and ATP to form AMP pyrophosphate and acetyl-CoA. It's a key step in the activation of acetate. Acetyladenylate, mixed anhydride between the carboxyl group of acetic acid and the phosphoric residue of adenosine 5' monophosphate. Acetylase, an enzyme catalyzing acetylation or deacetylation, as in the formation of N-acetylglutamate from glutamate plus acetyl-CoA, or the reverse. Acetylases are usually called acetyltransferases. Acetylation, formation of an acetyl derivative. Acetylcholine, the acetic ester of choline. the neurotransmitter substance at cholinergic synapses. It's hydrolyzed rapidly into choline and acetic acid by acetylcholinesterases in the body, and it's by pseudocholinesterases is what produces it into the blood. Acetylcholinergic, pertaining to the action of acetylcholine, or as it relates to neural or metabolic pathways in which it functions as a transmitter. Acetylcholinesterase, the cholinesterase that hydrolyzes acetylcholine to acetate in choline within the central nervous system and at peripheral neuroeffector junctions, the motor endplates and the autonomic ganglia. Acetylcysteine, a mucolytic agent that smells like eggs, that reduces the viscosity of mucus secretions. It's used to prevent liver injury that's produced by acetaminophen and paracetamol toxicity. Acetyl-ornithine deacetylase, an enzyme catalyzing the hydrolysis of N2-acetyl-L-ornithine to L-ornithine and acetate. Acetyl-salicylic acid, a non-steroidal anti-inflammatory agent, a non-selective cyclooxygenase inhibitor that is colloquially known as aspirin. Acetyltransferase, any enzyme transferring acetyl groups from one compound to another. Achalasia, failure to relax, referring specifically to visceral organs such as the pylorus, cardia, or any other sphincter muscle. Achard, referring to Émile Achard, a French physician, born 1860 and died 1941. Achard syndrome, arachnodactyly with small receding mandible, broad skull, and joint laxity limited to the hands and feet. The genetics and the pathophysiology are unclear. Achard-Thiers syndrome, obsolete term for a form of a virilizing disorder of adrenocortical origin in women, characterized by masculinization and menstrual disorders in association with manifestations of diabetes mellitus, such as glucosuria. Ache, a dull, poorly localized pain, usually of less than severe intensity. Achillia, congenital absence of the lips. Achillios, characterized by or relating to achillia. Achuria, congenital absence of one or both hands, also defined as anesthesia in one or both hands with loss of the sense of possession of the hand or hands, also defined as a sensibility disorder in which the patient is unable to identify which side of the body has received a stimulus. Achuropathy, congenital absence of the hands and feet. It is autosomal recessive in inheritance. Achenbach syndrome, hematoma of the finger pad with accompanying edema of unknown cause in the absence of disturbances in blood coagulation mechanisms. Achievement age, age derived from a given level of achievement on a standardized test, which can be compared with a person's chronologic age. Achievement motive, an acquired chronic need to succeed in the face of recognizable obstacles. Its strength is usually diagnosed from recurring themes and stories patients tell while taking a thematic apperception test or from other assessment instruments that is used by clinical psychologists. Achievement quotient, a ratio, percentile rating, or related quotient denoting the amount a child has learned in relation to his or her peers at the same level of education and at a similar age. Achievement test, a standardized test that is used to measure acquired learning in a specific subject, such as reading or arithmetic, in contrast to an intelligence test, which measures the potential ability or learning capacity. Achilles, mythic Greek warrior vulnerable to wounding only in his heel. Achilles reflex, the contraction of the calf muscles when the tendocalcaneus is sharply struck. Achillobursitis, inflammation of the bursa in proximity to the tendocalcaneus. Achillotendinotomy, cutting of the Achilles tendon. Achiral, not chiral, denoting the absence of chirality, meaning a lack of asymmetry that prohibits the structure and its mirror image to not be superimposable upon one another. Achlorhydria, the absence of hydrochloric acid from the gastric juice. Achlorhydric anemia, a form of chronic hypochromia, microcytic anemia associated with achlorhydria or acylia gastrica that's most commonly observed frequently in women within the 3rd to the 5th decades. Achlorophilus, without chlorophyll, as in fungi, humans, and mammals. Acoplasma, a genus of bacteria that has characteristics identical to those of the genus Mycoplasma, with the exception that the acoplasmas do not require sterol for growth. Saprophytic and parasitic species occur. Acoplasma appears as a contaminant in tissue culture media that have been supplemented with animal sera. The type species is Acoplasma laidlaui. Acoplasma exanthum, a bacterial species that's originally found in a murine leukemia cell line. Ecology, bovine, porcine, botanic. Acoplasma laidlaui, a bacterial species that occurs as a saprophyte in sewage, manure, humus, and soil. One of 2 species that are isolated from humans. Acoplasma oculi, isolated from eyes of caprines affected by keratoconjunctivitis. Keratoconjunctivitis, also isolated from goat udders and genital lesions, and from calves affected with bovine infectious keratoconjunctivitis. Acolia, suppressed or absent secretion of bile. Acolic, without bile, as in acolic or pale stools. Acholuria, absence of bile pigments from the urine, or in certain cases of jaundice. Acholuric, without bile in the urine. Acholuric jaundice, jaundice with excessive amounts of unconjugated bilirubin in the plasma and without bile pigments in the urine. Achondrogenesis, neonatal lethal dwarfism that is characterized by severe bone dysplasia of all 4 limbs, micromelia, enlarged cranium, and short trunk with delayed or absent ossification of the lower spine and the pubic bones. Achondrogenesis type 1A, an achondrogenesis with hypervascular cartilage and hypercellular bone, uncertain inheritance pattern. Achondrogenesis type 1B, an achondrogenesis with severely disorganized intracartilaginous ossification, autosomal recessive inheritance that's caused by mutation in the diastrophic dysplasia sulfate transporter gene DTDST on chromosome 5q. achondrogenesis type 2, achondrogenesis with autosomal dominant inheritance caused by the mutation in the collagen type 2 gene COL2A1 on chromosome 12q. Achondroplasia. This chondrodystrophy is characterized by an abnormality in conversion of cartilage to bone. It's the most common form of short limb dwarfism, characterized by short stature with rhizomelic shortening of the limbs, large head with frontal bossing and mid-face hypoplasia, exaggerated lumbar lordosis, limitation of elbow extension, genu varum, trident hand, characteristic radiographic skeletal findings and neurologic symptoms complicating hydrocephalus and spinal canal stenosis. Autosomal dominant inheritance with most cases sporadic, caused by the mutation in the fibroblast growth factor 3 receptor gene, FGFR3, that is on chromosome 4p. Achondroplastic, relating to or characterized by achondroplasia. Achordate, referring to animal forms below the level of chordata that do not develop a notochord or a chorda. Achoresis, a permanent contraction of a hollow viscus, such as a bladder or a stomach, whereby its capacity is reduced. Achorion, a former name for dermatophytes that are now placed in the genus of Trichophyton or Microsporum. Acristic anemia, a form of chronic progressive macrocytic anemia, potentially fatal, in which the changes in bone marrow and circulating blood closely resemble those of pernicious anemia, but in which there is only, at best, transient response to therapy with vitamin B12. Glossitis, gastrointestinal disturbances, CNS disease, and pyrexia are usually not observed in this instance, and there is little bleeding or hemolysis. Achoriocyte, a colorless cell. Achromasia, a pallor that's associated with Hippocratic facies, emaciation and weakness, often heralding a moribund state. Achromat, a person exhibiting achromatopsia. Achromatic, meaning colorless, also meaning not staining readily, also meaning refracting light without chromatic aberration. Achromatic apparatus, the staining and non-staining esters and spindle fibers within a dividing cell. Achromatic lens, a compound lens made of two or more lenses having different indices of refraction, so correlated as to minimize the chromatic aberration. Achromatic objective, an objective that is corrected for two colors chromatically and one color spherically. Achromatin, the weakly staining components of the nucleus, such as the nuclear sap and euchromatin. Achromatism, the quality of being achromatic, also defined as the annulment of chromatic aberration by combining glasses of different refractive indices and different dispersions. Achromatolysis, the dissolution of the achromatin of a cell or of its nucleus. Achromatophil, achromatophile, not being colored by the histologic or bacteriologic stains. It's also defined as a cell or tissue that cannot be stained in the usual way. Achromatophilia, a condition of being refractory to staining processes. Achromatopsia, a complete form of achromatopsia characterized by severe deficiency of color perception associated with nystagmus, photophobia, reduced visual acuity, and day blindness. It's of autosomal recessive inheritance. One form, achromatopsia type 1, maps to chromosome number 14. Achromatopsia type 2 is caused by mutation in the cone photoreceptor cGMP-gated cation channel alpha subunit 1 gene CNGA3 on chromosome 2q. Achromatopsia type 3 is caused by mutation on CNBG canonically on chromosome 8q. Achromatous, meaning colorless. Achromaturia, the passage of colorless urine or very pale urine. Achromia, hypopigmentation, absence or loss of natural pigmentation of the skin and iris, may be congenital or acquired, also defined as a lack of capacity to accept stains in cells or in tissue. Achromia parasitica, a phase of lessening or absent pigmentation in cutaneous lesions caused by the fungus Malacia furfur. Achromic, meaning colorless. Achromobacter, a gram-negative bacterial genus of uncertain clinical significance, closely related to the members of Alcaligenus or Acrobacterium species. Achromocyte, a hypochromic crescentic erythrocyte, probably resulting from artifactual rupture with loss of hemoglobin. Achromotrichia, absence or loss of the pigment in the hair. Acroodextrin, dextrin of low molecular weight that's formed from starch in a stage of the digestion of the latter by amylase. It produces no color when reacted with iodine. Achilia, absence of gastric juice or other digestive secretions. Also the absence of chyle. Chylia gastrica, diminished or abolished secretion of gastric juice associated with atrophy of the mucous membrane of the stomach. Achilia pancreatica, deficiency or absence of pancreatic secretion, usually resulting in fatty stools, emaciation, and impaired nutrition. Achilous, a state that is lacking in gastric juice or other digestive secretions, also meaning having no chyle. Acicular, needle-shaped or needle-pointed, applied particularly to leaves and crystals. Acid, a compound yielding a hydrogen ion in a polar solvent in water. Acids form salts by replacing all or part of the ionizable hydrogen with an electropositive element or radical. It's also defined colloquially as any compound that has a sour taste that has been traditionally given by the hydrogen ion. Third definition, sour, sharp to the taste. Fourth definition, relating to acid, giving an acid reaction. For individual acids not shown in the dictionary, please see the specific names. Most commonly in the body is hydrochloric acid. Acid agglutination, the clumping together of certain microorganisms at high hydrogen ion concentrations. Acid alcohol is ethyl alcohol, 70%, containing 1% hydrochloric acid. Acid dextran, the product of acid and heat treatment of dextran. Acid dyspepsia, a dyspepsia associated with excess gastric acidity. Acid etch cemented splint, a splint of heavy wire that is cemented to the labial surfaces of teeth with any of the acid etch cement techniques. It's used to stabilize traumatically displaced or periodontically diseased teeth. Acid fuchsin, a mixture of sodium salts, bi- and trisulfonic acids of rosanilin and para-rosanilin, used as an indicator dye and for staining of cytoplasma and collagen. Acid gland, one of the gastric secretions that secretes the hydrochloric acid of the gastric juice. Acid indigestion, an indigestion that results from hyperchlorhydria, often used colloquially as a synonym for pyrosis. Acid intoxication, poisoning by acid products, beta-oxybutyric acid, diacetic acid, or acetone, formed as a result of faulty metabolism, usually from uncontrolled diabetes mellitus, or by acids introduced from without. Marked by epigastric pain, headache, loss or appetite, constipation, restlessness, and an odor of acetone that's found on the breath, followed by air hunger, coma, and ultimately resulting in collapse. Acid oxide, an acid anhydride, an oxide of an electronegative element or radical. It can combine with water to form an acid. Acid phosphatase, a phosphatase with an optimum pH of less than 7. For several isozymes, the optimal pH is 5.4. Notably present in the prostate gland. Demonstrable in lysosomes with Gomori, nonspecific acid phosphatase stain. It hydrolyzes many orthophosphoric monoesters. Acid radical, a radical that's formed from an acid by loss of one or more hydrogen ions. Acid reaction is any test by which an acid reaction is recognized, such as the chain of blue litmus paper to red. It's also defined as an excess of hydrogen ions over hydroxide ions in aqueous solution indicated by a pH value less than 7 at 22 degrees Celsius. Acid reflux test, a test to detect gastroesophageal reflux by monitoring esophageal pH, either basally or after acid is instilled into the stomach by means of an electrode in the distal esophagus. Acid rigor, coagulation of muscle protein that's induced by acids. An acid salt, a salt in which not all of the ionizable hydrogen of the acid is replaced by the electropositive element. So NaHSO4 and KH2PO4 are examples. Acid tartrate, a salt of tartric acid that contains an acid that's still capable of combining with an acid, also known as a bitartrate. Acid tide, a temporary increase in the acidity of the urine that occurs during fasting. Acid-base balance, the normal balance between acid and base in the plasma expressed in hydrogen ion concentration or pH, resulting from the relative amounts of acid and basic materials ingested and produced by body metabolism, compared with relative amounts of acidic and basic materials excreted from the body and consumed by body metabolism. The normal state of acid-base is not one of neutrality, with equal concentrations of hydrogen and hydroxyl ions, but more an alkaline state with a certain excess of hydroxyl ions. Acid citrate dextrose, a citrate anticoagulant used for the collection and preservation of whole blood. It has largely been replaced by newer anticoagulants that allow for longer shelf life for blood and for blood products. Acid-etched restoration, the restoration of tooth structure with a resin after the surface of the tooth has been treated with an acid solution that etches the tooth surface, thereby increasing the retention of the restoration. Acid fast, denoting that bacteria that are not decolorized by acid alcohol after having been stained with dyes such as basic fuchsin, the mycobacteria and nocardiae. Acidemia, an increase in the hydrogen ion concentration in the blood, or a fall below normal in pH. Individual types of acidemia are listed by specific name. For example, isovaleric acidemia, aminoacidemia, acidic amino acid, an amino acid with a second acid moiety, glutamic acid, aspartic acid, cysteic acid are all examples of this. Acidic dyes, dyes that ionize in solution to produce negatively charged ions or anions. They consist of sodium salts, of phenols, and carboxylic acid dyes. Their solutions tend to be neutral or slightly alkaline. Examples are eosin and aniline blue. Acidic stain, a dye in which the anion is the colored component of the dye molecule, sodium eosinate, also known, or really just eosin. Acidified serum test, lysis of the patient's red blood cells in acidified fresh serum, specific for paroxysmal nocturnal hemoglobinuria. Acidify, to render acid, to add in hydrogen ions, to become acidic in common models, meaning to gain hydrogen ions and increase the concentration of H+. Acidity, the state of being acid. Also, the acid content referring to the hydrogen ion concentration of a fluid. Acidophile, a structure, cell, or other histologic element staining readily with acidic dyes. Also defined as one of the acid staining cells of the anterior pituitary. Third definition, a microorganism that grows well in a highly acidic medium. Acidophile anemia, adenoma. Acidophile adenoma, a tumor of the adenohypophysis in which cell cytoplasm stains with acid dyes grow often but not invariably produces hormones. Acidophile cell, the cell where the cytoplasm or granules of which stain with acid dyes. Acidophile granule, a granule that stains with an acid dye such as eosin. Acidophilic, having an affinity for acid dyes, denoting a cell or tissue element that stains with an acid dye such as eosin. Acidophilus milk, milk that is inoculated with a culture of Bacillus acidophilus. Acidosis, a pathologic state that's characterized by an increase in the concentration of hydrogen ions in the arterial blood above the normal level 40 nanomoles per liter, or pH that is less than 7.4. It may be caused by an accumulation of carbon dioxide or acidic products of metabolism, or by a decrease in the concentration of alkaline compounds. Acidotic, pertaining to or indicating acidosis. Aciduria, excretion of an acid urine. It's also defined as an excretion of abnormal amount of any specified acid. Individual types of aciduria are prefixed by the specific acid, aminoaciduria or ketoaciduria. Aciduric, pertaining to bacteria that tolerates an acidic environment. Acinar, pertaining to the acinus. Acinus cell, acinar cell, any cell secreting lining of an acinus, applied especially to the cells of the pancreas that furnish pancreatic enzymes to distinguish them from the cells of the ducts and the pancreatic islets of Langerhans. Acinar cell, a solid and cystic tumor of the pancreas, occurring in young women. Tumor cells that contain zymogen granules. Acinetobacter, a genus of non-motile aerobic bacteria, family Moraxalaceae, containing gram-negative or variable coxoid or short rods or cocci, often occurring in pairs. Spores are not produced. These bacteria, they grow on ordinary media without the addition of serum. They are oxidase negative and catalase positive. Carbohydrates are oxidized or not attacked at all, and arginine dihydrolase is not produced. They are a frequent cause of nosocomial infections, often resistant to many antibiotics. They can cause severe primary infections in immunocompromised people, and the type species is Acinetobacter calcoaceticus. Acinetobacter calcoaceticus. Aceticus, a species of bacteria that's originally found in quinate enrichment. Strains of this organism are previously identified as Bacterium antitratum, where found normally in the genitourinary tract. It is the type species of genus Acinetobacteriaceae. Acini, plural of acinus. Acinic cell, adenocarcinoma. An adenocarcinoma arising from secreting cells of racemose gland, particularly that of the salivary glands. Acinos, resembling the acinus or grape-shaped structure. Acinus gland, a gland in which the secretory unit has a shape like grape-like shape, and a very small lumen, the exocrine part of the pancreas. Acinus, one of the minute grape-shaped secretory proteins of an acinus gland. Some authorities use the terms acinus and alveolus interchangeably, whereas others differentiate them by constricted openings of the acinus into the excretory duct. Achy poisoning, an acute and frequently fatal vomiting disease associated with central nervous system symptoms and marked hypoglycemia caused by eating unripe ackee fruit of Blighia spada, a tree that's common in Jamaica, pathologically shown as microvesicular steatosis. Aclasis, a state of continuity between abnormal and normal tissue. Acme, the greatest period of intensity of any sign, symptom, or process. Acne, an inflammatory follicular, papular, and pustular eruption involving the pilosebaceous apparatus. Acne artificialis, acne that's produced by external irritants, such as tar, that would result in chloracne, or by normally orally administered drugs, internally administered, such as iodides or bromides. Acne cachectoricum, an acne that derives from people having a debilitating constitutional disease, characterized by a large, soft, purulent, ulcerative, cystic, and scarred lesions. Acne ciliaris, follicular papules and pustules on free edges of the eyelids. Acne conglobata, acne conglobata, severe cystic acne, characterized by cystic lesions, abscesses, communicating sinuses, and thickened nodular scars, usually does not affect the face. Acne cosmetica, low-grade non-inflammatory acne lesions resulting from repeated application of comedogenic agents that are found inside cosmetics. Acne fulminans, severe scarring acne associated with fever, polyarthralgia, crusted ulcerative lesions, weight loss, and anemia. Acne generalis, acne lesions involving face, chest, and back. Acne hypertrophica, acne vulgaris, in which the lesions on healing leave hypertrophic scars. Acne keloid, a chronic eruption of fibrous papules that develop at the site of deep folliculitis, usually on the back of the neck at the hairline. Acne medicamentosa, acne that's caused or exacerbated by drugs, lithium, halogens, or steroids. Acne neonatorum, a condition of neonates that's characterized by papules, pustules, and comedones on the foreheads and cheeks, usually resolving within a few months. Acne punctata, acne with black open comedones. Acne pustulosa, acne vulgaris, which pustular lesions predominate. Acne varioliformis, a pyogenic infection involving follicles occurring chiefly on the forehead and temple. Involution of the umbilicated and crusting lesions is then followed by scar formation. Acne vulgaris, an eruption predominantly on the face, upper back, or chest, composed of comedones, cysts, papules, and pustules, and on an inflammatory base. The condition occurs in a majority of people during puberty and adolescence due to androgenic stimulation of sebum secretion, with plugging of follicles by keratinization associated with proliferation of Propionibacterium acnes. Follicular separation may lead to scarring. Don't pop them. Topical treatments include tretinoin, benzoyl peroxide, and antibiotics. Sunlight, systemic antibiotics, and oral 13-cis-retinoic acid are also effective. Acneiform, resembling that of acne. Acnemia, congenital absence of legs. Atrophy of the muscles of the calves and legs. ACNM, abbreviation for the American College of Nuclear Medicine. ACNP, abbreviation for the American College of Nuclear Physicians. Acocanthera, juice from the leaves and stems of the Acocanthera obio, family of related species, an African arrow, poison containing ouabain. Acolus, without limbs. Aconitase, hydratase, an iron-containing enzyme catalyzing the hydration, or the dehydration rather, of citrate to cis-aconitate, a reaction of significance in the tricarboxylic acid cycle. Aconite, the dried root of Aconitum napellus, commonly known as monk's hood, or wolfsbane, a powerful and rapid-acting poison formerly used as an antipyretic, diuretic, diaphoretic, anodyne, cardiac and respiratory depressant, and externally as an analgesic. Aconitine, the exceedingly poisonous active principle of aconitum and delphinium, formerly used as a cardiac sedative and applied externally for neuralgia. Acoria, congenital absence of the pupil of the eye. Acorn-tipped catheter, a catheter used in uretopilography to occlude the uteral orifice and prevent backflow into the ureter during and following the injection of an opaque medium. Acosta disease, an altitude sickness. Acoustic, pertaining to sound, acoustic trauma, or acoustic wave. Acoustic agraphia, inability to write from dictation. Acoustic area, in the brain, the floor of the lateral recess of the fourth ventricle, extending medially to the limiting sulcus and overlying the cochlear and vestibular nuclei of the rhombencephalon. Acoustic cell, a hair cell of the spiral organ. Acoustic enhancement, a manifestation of increased echo amplitude returning from regions beyond an object such as a fluid-filled cyst, which causes little or no attenuation of the ultrasound beam. Acoustic impedance, the resistance that a material offers to the passage of a sound wave, a property of a medium computed as the product of density and sound propagation speed, characteristic acoustic impedance. Discontinuities in acoustic impedance are responsible for the echoes in which ultrasound imaging is based upon. Acoustic lens. In ultrasonography, a lens that's used to focus or diverge a sound beam may be stimulated or simulated by electronic manipulation of signals. Acoustic nerve, an almost obsolete term that's still sometimes used incorrectly to designate the vestibulocochlear nerve, cranial nerve number 8. Acoustic neurolemoma, schwannoma arising from cranial nerve number 8. Acoustic pressure. In ultrasound, the instantaneous valve of the total pressure minus the ambient pressure, and the unit of measure is the Pascal. Acoustic radiation, the fibers that pass from the medial geniculate body to the transverse temporal gyri of the cerebral cortex by way of the sublentiform part or limb of the internal capsule. Acoustic reference level, the biological reference level for sound measurements. When the term decibel is used to indicate the intensity of a noise level, a reference quantity is implied. This reference value is usually expressed as a sound of 20 micropascals or 20 micronewtons per square meter. The reference level is referred to as 0 decibels, the baseline of the scale of noise levels. This baseline is considered the softest sound that can be heard by a person with very good hearing on an extremely quiet location. Other reference levels still being used include 0.002 microbar and 0.0002 dyne per square centimeter. Acoustic reflex, contraction of the stapedius muscle in response to intense sound, increasing impedance of the middle ear and thereby protecting the middle ear from excessive sound. Acoustic shadow, sonographic appearance of reduced echo amplitude from regions lying beyond an attenuating object. Acoustic spots, search for macula of the utricle, macula of the saccule, of which they are related. Acoustic simulation tests, a test for fetal well-being in which an acoustic device is used to stimulate the fetus and accelerate its fetal heart rate. Acoustic teeth, a tooth-shaped formation or ridge occurring on the vestibular lip of the limbus laminae spiralis of the cochlear duct. Acoustic tetanus, an experimental tetanus that's induced by a faradic current, the speed of which is estimated by the pitch of the vibrations. Acoustic tolerance, the maximum sound level pressure that can be experienced without producing pain or permanent hearing loss in a normal individual. Acoustic trauma hearing loss, sensory hearing loss that results from the exposure to high-intensity noise. Acousticofacial ganglion, a primordial ganglionic cell mass in early embryos that later separates into acoustic or spiral ganglion of the vestibular cochlear 8th cranial nerve, and geniculate ganglion of the facial 7th cranial nerve. Acousticophobia, morbid fear of sounds. Acoustics, the science concerned with sounds. ACP, abbreviation for acyl carrier protein. American College of Physicians is another abbreviation. ACP, acetyltransferase, an enzyme that transfers acetyl group from acetyl-CoA to ACP and releases CoA to begin fatty acid synthesis. ACP melanyltransferase, an enzyme that transfers melanyl group from melanyl-CoA to ACP and releases free CoA, a key step in fatty acid synthesis. Acquired, denoting a disease, predisposition, or abnormality that is not inherited. Acquired ataxia, a genetic term used to describe cerebellar syndromes related to various environmental agents or to other diseases, such as ethanol consumption, medications, anticonvulsants, infections, tumors, cerebral vascular disease, multiple sclerosis, and autoimmune mechanisms. Acquired character. A character developed in a plant or animal as a result of environmental influences during that individual's life. Acquired eccentric relation. An eccentric relation that is assumed by habit to bring the teeth into occlusion. Acquired hemolytic anemia. Non-hereditary, acute, or chronic anemia associated by extracorpuscular factors, certain infectious agents, chemicals including autoantibodies or therapeutic agents, burns, toxic materials from higher plant and animal forms, including snake venoms. Acquired hemolytic icterus. Icterus and anemia occurring in association with a moderate degree of splenomegaly, increased fragility of red blood cells, and increased urobilin, increased amounts of urobilin in the urine. Acquired hypolipoproteinemia, a non-familial hyperlipoproteinemia that develops as a consequence of some primary disease such as thyroid deficiency. Acquired ichthyosis, right? Acquired ichthyosis, a thickening and scaling of the skin associated with some malignant diseases, such as Hodgkin lymphoma, leprosy, and severe nutritional deficiencies. Acquired immunity, resistance resulting from previous exposure of an individual in question to an infectious agent or antigen. It may be active and specific as a result of naturally acquired, apparent or inapparent, infection or intentional vaccination, artificial active immunity, or it may be passive, being acquired through transfer of antibodies from another person or from an animal, either naturally as from a mother to a fetus or by intention inoculation, artificial passive immunity. Acquired immunodeficiency syndrome, an abbreviation for AIDS. Acquired megacolon. A megacolon occurring in association with acquired disease occurs in inflammatory bowel disease, toxic megacolon, and Chagas disease, a South American trypanosomiasis. Acquired methemoglobinemia. A methemoglobinemia that's caused by various chemical agents, such as nitrates, or topical anesthetics. Acquired nevus, a melanocytic nevus that is not visible at birth, but it appears in childhood or in adult life. Acquired pellicle. Acquired pellicle, a thin film about 1 micrometer derived from salivary glycoproteins that forms over the surface of a cleansed tooth crown when it is exposed to saliva. Acquired ptosis, a heterogeneous disorder caused by neurogenic, Horner syndrome, myogenic, myasthenia gravis, traumatic, or mechanical causes. Acquired tufted angioma, enlarging erythematous papules and macules, plaques in children and adults, composed microscopically of lobules and capillaries and spindle cells that project into thin wall, venular, dermal clefts. Acquisition. In psychology, the empiric demonstration of an increase in strength of the conditioned response in successive trials of pairing the unconditioned and conditioned to stimuli. I recited the medical dictionary for 3 hours from memory. This is how my kidneys shut down CE is a 34-year-old man presenting to the emergency room with abdominal pain radiating to his back. He tells the admitting nurse that he had not urinated for more than 6 hours. You see, CE was making a 3-hour YouTube video for April Fool's Day. He wanted to impress everyone with his memory, but he found out that he couldn't urinate. So therefore, CE is suffering from hydronephrosis. Hydro meaning water, nephro pertaining to the kidneys, and osis meaning abnormal state. An abnormal state of the kidneys due to an excess of water, as the urine backed up from his bladder into his kidneys. His kidneys exploded.